as Saptarishi Bosar has said, we need to communicate, collaborate, and coordinate with other disciplines. So today we'll take this opportunity and we have our guest speakers. That is S.R. Rao sir, who is a professor from Andhra University. He is a meteorologist. And there is Dr. Hemant Kumar sir, who is a veterinary assistant surgeon. And one more guest speaker is there. He is the professor and HOD from MKCG College, Odisha. He is yet to come. Dr. D.M. Satpathy, sir. Now we will proceed to the lamplighting ceremony. So I invite all the dignitaries, please kindly join together for this light lamping.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च पतिं स्वच्छामि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठेत् गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
So thank you, sir, for coming here. So today we have gathered here on One Health Academic CME. So we have taken this opportunity to collaborate across disciplines. So only we have requested from meteorology department, from veterinary department, and there is one more speaker who is a professor and HOD in the Department of Community Medicine, who is the Rabies State Control Program Officer, ma'am. He is trying.
A very good morning to all of you and a warm welcome to this CME. Now, I think it's very appropriate to choose the topic One Health. We think that only we are healthy and we should be healthy, but we always tend to forget that the environment should be equally healthy and all those which are causing ill health to us, everything should be properly controlled. But then we hardly give any importance to all that, just ignoring. Not that we don't know, but we ignore all such things. Now, this is a wonderful topic chosen by Dr. Bose. I should really congratulate him. Now he is trying to bring about the coordination between a human being, an animal, and the environment. Now, accordingly, he has chosen stalwarts in the respective fields, like one from the meteorology department. Thank you, sir, for being here. And one from the veterinary assistant surgeon. Thank you, sir, for being here. Now, I think this is going to be a comprehensive approach to learning for a good health. So, this is a very good idea, very good program, and I wish all of you will definitely get benefited out of it. My sincere request is please close your mobiles for a while, at least keep them in silence and make a down your into your mobile, keep your head straight, close your mobiles, and concentrate on what's happening because you're the future. You're going to talk about all this to your juniors. So you should be experts now. And this is first step to really learn a lot from such learned persons over here. So thank you all. Wish you a very, very happy learning today and a fruitful learning. Thank you so much. And community medicine department is not just a branch of medicine. It is something very high. When you talk about medicine, MBBS or MD or any other thing, without community medicine, without knowledge of it, there is no profession called medicine because it is so important. And realizing that fact, NMC has included community medicine with one of the clinical subjects. Now it goes with medicine, surgery, gynec, and pediatrics. So you are all well placed high above all. So you all have to really take it as a prestige and try to learn the best out of all this. Thank you all.
Now I would request our academic director, Dr. Sudhir sir, to speak a few words.
Respected Dean Dr. Lakshmi Lalita and all other dignitaries on the dais and all visiting faculty and all good friends and our students. Good morning to all of you. The theme that is selected is really a theme that is required for today's world. See, the greatness of creation, we we have not realized, the humankind has not realized. This is a balance between the plant kingdom and the animal kingdom. These are the two things that are seen on this earth. The balance is not realized. That's why many of the ills of this world could not be controlled. The balance, the requirement of making the mutually helpful is not properly identified by the governments or the people. That's why we are facing many of the problems, ills, diseases in this world. See, when the research started, we are simply focused on the human problems because we are the supposed to be the elitist of the world. So we are focusing on this thing. But the fact is, if we focus on ourselves, nothing will come out. We are living together. Not the human beings are living together. We are living with animals. We are living with trees. We are living with the soil. And all these things will contribute for the better or the bad things of this world. So if we realize this importance of the mutually dependability of these all these stakeholders on this earth, I think we can bring out the best of the uh, human living in this. Not only for human living, living for the better. This is the thing being realized. I think now the focus is more on this. That is the integration of all these things. Now we are discussing, and it's the right thing, right time, and hope all of you understand the broadness of this topic and that broadness, and taking care of the other stakeholders on this year. If you do that, I think we'll be achieving the good health simultaneously. Uh, I mean, not finding the requirement of many medications and all those things. I think this session, this conference would enlighten all these points and inspire our young budding doctors to realize about this and think any problem in a broader perspective, not in a narrow perspective. And see, world is changing. I'll tell you, in the medical specializations, there are so many specializations have come that nephrology, cardiology, gastroenterology like that. That we are focusing on the thing. But the time is changing in such a way that the day will come when gastroenterologist is going to treat the diabetes. The subjects are interdependent becoming, and the inner intricacies now slowly being realized. There are no boundaries. The boundaries will slowly disappear. Everyone can manage everything related to the health. That situation will come. So for which the younger generation should get geared up for this sort of a situation to face, and hope this conference will serve the purpose. And I congratulate both for taking up this such a theme and conducting this CME. Wish you all the best. Thank you.
I would like to call upon our medical superintendent, Dr. Ashok Reddy, sir, to fix me with this.
Good morning to all of you, respected dignitaries on the dais of the dais, faculty and students from various medical colleges. Actually, I'm happy to see students from different medical colleges have this opportunity to have a look at our GEMS hospital. Don't worry, this will continue. You can have and this is an opportunity to interact among yourselves because you'll be in your own colleges. Now, this is the opportunity to interact, collaborate, and interact with the faculty. And I really congratulate our Saptarshi Bose for roping in the experts from the Andhra University and from the veterinary and organizing such a CME with all the zeal. It's not possible usually. Really, thank you, sir. And congratulations once again. Go ahead with this.
I would like to call upon our medical director, Dr. Hemant, sir.
Good morning to all, respected dignitaries on the dais, my dear colleagues, and faculty members, and the attendees of this today's CMS program. At the outset, I heartily welcome all of you to our institute for attending this CME program. Secondly, I would like to congratulate the Department of SPM led by Professor Bose for conducting this interdisciplinary approach in conducting this CME. It's a very good approach wherein there will be a coordination between all the allied departments leading to better thoughts and better suggestions for implementation. Finally, coming to the topic One Health, this is one of the burning topics in today's world. As we all know, we are seeing a rapid change in the world today, leading to drastic changes in the climate and formation of new diseases which are challenging the existence not only of the mankind but the entire environment as a whole. So in the past, probably due to a maintenance of a balance in the ecology, the incidence or the types of diseases or the number of diseases was low, and also probably due to less infrastructure also we may not be able to diagnose. But during the past few decades, we have seen many newer varieties of diseases and a rapid change in the climate, which has resulted in a lot of disturbances in the balance in the environment. And today, the whole world is looking at this with a lot of apprehension, basically with the idea that if these changes continue, the existence of the world itself may be a big question mark in the coming decades. So it is the right time, if not late, for us to once again make changes so that the balance is restored and each one of us live in peace so that the world will be a better and a happy place to live. I'm sure during the course of this CME, these discussions will come up with a lot of number of suggestions which will help us develop our skills and knowledge. So once again, I thank you for calling on me, and happy learning to all of you. Thank you.
I would like to call upon our Chief Operating Officer, Dr. Sridhar, sir.
Good morning to all the dignitaries and the students who have come here for listening to this One Health. I really congratulate the Department of Community Medicine for this triad. Actually, most of the time we will forget about this triad. We are so selfish that if a human is healthy, it's enough. But the selfishness is good. But to achieve this selfishness of human being healthy cannot be achieved without the healthiness of our environment and of our animals which are there around us. So in one way, most of the time, the community medicine department do integrated programs with the different departments like gynecology, pediatrics, general medicine for all these things. Fine, but that will not solve the purpose of community health unless they integrate it with the society. And especially when we talk about the society, yes, they are doing with the society. Here I'm going to say that it is with the environment. So the environment has to come into play, the agriculture people has to come into the play, and one of the topmost people who have to come into play is the animal health. There's the veterinary people, and this is the integration what they have done. So even if you look into the past about any type of diseases, zoonotic or anything, only one disease were able to completely eradicate, a smallpox. That's just because it doesn't have any other host other than us. But if any disease or anything has any other host, it's very tough to eradicate. We know what we are doing with polio since last 25, 30 years. And nowadays, the burden of NCDs, non-communicable diseases, are increasing. And if you think even non-communicable diseases are only limited to human beings, that is, you take care of the human, that's fine. No, we have to take care from the environment side, from the veterinary side. Then only the non-communicable disease of the human burden also will come down. So this is a very important triad what he has chosen. I was in the past 20, 25 years, I was attending a lot of conferences in medical college, but I never seen a community medicine department integrating with these departments. So this is the first time I'm seeing. And one more thing it is, um, these postgraduates in the community medicine departments are like jack of all trades. And they should be jack of all trades. They should know everything. And rather it is very interesting, this thing it is, the post-graduation period is only 3 years for every subject. I would say that post-graduation period for community medicine should be 4 years. Might be people will scold me because the subject is so vast that you should be sent even to the veterinary posting for 3 months or 4 months to know about the problems there, because indirectly they are communicating to us. So I know how many people know about the veterinary and what problems they're facing. Definitely Dr. Hemant here will be enlightening us on all that grounds. And they should be get posted into the agriculture side also, because at the end of the day, they are going to get impacted on us. Okay? And I know the community medicine textbook is one of the fattest textbook in our medical department or in our medical specialties. So thank you all. And I hope the PGs will go up with a enlightenment about especially the cross specialities. Thank you.
I would like to call upon our PG academic coordinator, Dr. Ramarao, sir.
I welcome all the not students. You are the angels or messengers of health in future. The thing is, as per the definition of health, physical, mental, and environmental health. The physical and mental health so far we are taking care of. So many departments have come on other things. The environmental health is very much neglected. Now we have to take care of that. and because you are the healthcare carer of the society. We are all the healthcare of a individuals, patients, and other things. You are interested in the society as a broad sense. So, so environmental health you have to take care of. Then only the society will be healthy. With that, so I hope that you will spread this message of learning uh, to the society and serve better, so that already we have prevented so many diseases and new diseases are coming, and there is now we are flooded with malignancies now. So we have malignancies now. Some of the diseases we are having vaccinations, and some yet to come. Even malaria also we are having a vaccine. Now HIV also there is a vaccine, and it has to be developed further, and it has to come to other countries also. I think South Africa they are having HIV vaccination. So this is the thing where unless the preventive medicine is there, concentrating on the prevention of the disease, this is the day of the hour of the day. We have to understand the prevention, and the presently the topic is now environmental health. I hope you will concentrate on the environmental health and spread this message to the society. Thank you.
So now I would first like to thank all the dignitaries to take out some time of their busy schedule and come here and grace us with their presence. Now I will request Dr. Varsha to carry on with the session.
After hearing After hearing to all the dignitaries, we feel like we are every one of us is a stakeholder for sustainable planet and sustainable futures to come. Definitely, thank you, ma'am. Thank you, sir. PGs from AMC. Okay. AMC, they are the PGs now. From RMC, anyone has come? Okay. 18. Okay. From GSL. Okay. From GSL now. GSL, from GSL postgraduates, please raise your hands. Okay. Kim Samalapuram? Anyone from Kim Samalapuram? No. Okay. Yeah, from? No.
Please, please. So everyone, please give a warm welcome to Dr. Durga Madhav Satpathy. He is professor of community medicine as well as the medical superintendent of MKCG Medical College, Berhampur. Next, I would like to let me introduce the other guest speakers. So please, I would like to invite Dr. S.R. Rao, sir. Okay, he is an environmentalist. He will be speaking on the part of the environmental health under One Health initiative. Dr. Hemant, he is a veterinary surgeon, as introduced. He will be speaking on the animal part of the One Health initiative. So I hope that you people have something to take on. Like I have a take-home message in my PowerPoint. You something really have a take-home message from them.
Thank you, sir. Next, we'll go to the other session. Okay, is it fine for you? So I would like to call Dr. B. Hemant Kumar sir, veterinary assistant surgeon, to share his insights and expertise. Yeah, you want it?
Hemanji,
Okay, small change in the schedule. So first, I would like to call Dr. D.M. Satpathy sir, who is a professor and Rabies State Control Program Officer. He is a respected public health expert to kindly deliver on rabies control program through a One Health approach. Thank you, sir. Please welcome onto the stage, sir. Yes.
small audience without mic. Thank you. We are still in the morning. And thanks, Hemant, for allowing me to come first. Like, Hemant, you was great in that aspect. Because I'll be again back in my office chamber by 3 p.m. So thank you, everyone. Thank you, Professor Bose, for inviting me to this CME workshop on One Health, which we have been doing for the last few days. And as it is said, I am Dr. Dugamadhav Satpathy, uh, Professor of Community Medicine. I was the professor and head of the Department of Community Medicine. but fortunately or unfortunately, I was promoted to the post of medical superintendent. So I am stuck with the aspect of professor of community medicine. HOD is now out. So that's it. And I am the president of APCRI, Association for Prevention and Control of Rabies in India, along with President IPHA Odisha State Bank, Vice President Indian Society for Adult Immunization, etc. But for us today, I'll tell you that I am the president of APCRI, and today we will discuss on an important topic, that is rabies. Slide changes. Uh, uh, yes. Please, next, please. So, before going to the topic proper, uh, just a minute, back. Uh, we have to pay our respects to this great famous scientist, Louis Pasteur, who was the person behind making this disease, which is 100% fatal, to almost a preventable one. Once it was said, rabies is 100% fatal, but 100% preventable. It was said like that. And I also said like that. At Hanoi, when I was there, you must have known his name or not. We had a great rabies consultant, world famous, uh, Professor Henry. So he called me up at the end of my speech and said, Chhatrapati, he could not say the name anyway. Uh, Please remember, don't say 100% preventable, but preventable. 100% fatal, no doubt, but preventable, but don't say 100% preventable, because if the virus is directly injected into a nerve, then gone. Our motto is to prevent the virus from entering a peripheral nerve ending. That is what we do. But if it is directly injected into a nerve, how can we prevent? So don't say 100% preventable. From that day onwards, I have cut that sentence. So this is what we know, and we are Great which, you see, still in 2025, which is going to end also very soon, we are still having rabies as a public health burden among the community. Right? Agreed? Isn't it? But see, it is not a new disease. It is there since ages. And in fact, the word of rabies comes from our own Sanskrit word rebhas, which is mentioned in the Rig Veda. It is not a new disease like COVID or even HIV. It is there since ages, and it is a very ancient disease, rebhas, which means to do violence. 100%, that's why I changed. I told you, na, 100% fatal disease, but preventable. I changed that 100% preventable. So this is what we mean. And our objective is to prevent. And we know that, of course, these figures are getting down day by day. Uh, 50 to 70,000 deaths due to rabies occurs every year. Nowadays, it was said that main vector is the dog for the community, leading to transmission of rabies because it is a zoonotic disease, isn't it? That's why we are all here for One Health, so that we can take steps as far as One Health is concerned. Safe human, safe environment, safe animal. All are concerned. So the main victim is the dog. In India also, uh, there was a reported 30,000 deaths, but a recent NIE cum ICMR survey which was conducted in the year 2019, 18-19, it has shown that it has drastically fallen to about 7,000. The report will be soon published. From 20,000, it has drastically reduced to about 6,000 to 7,000. But still, it is more because of a huge canine population. Right? Canine population, 25 million dogs present. And it is said that in India, there is, for every 25 Indians, there is a dog. Right? But imagine in the night, when you are moving on a road, there will be one Indian and 25 dogs. That's what happens. So be careful when you are moving in the night because medicos usually have a tendency to move in the night. Right? We prefer that time. So that's what it is there. And we have a huge population of dogs. Majority of them are unimmunized in nature. Bosley, please stop me if I am overcrossing the limit of time. Because what rating is given to me, I don't know when to stop. I hope I will complete it. Don't you? And I won't bore you. I will complete it in time. And these are the various animals which transmit rabies. We know one of them, mind you, is a mongoose, which is not, which belongs to rodent family. But mongoose can transmit rabies. That's why now I tell you why one importance of dealing with anti-rabies, which is 100% fatal, is it is better to overtreat than to undertreat. Right? So I got a case during my career. I got a case where he was a woodcutter. He had gone to the forest for cutting wood, and he had a history of no animal bite except a rodent, wild rodent bite, maybe a squirrel, maybe something. That was the only exposure. Fortunately, that person died. Okay, very sad picture. In rabies, what happens? You see, sensorium remains intact till the end. He or she is able to recognize the relatives present in and around him. Due to hydrophobia, he cannot even see the sight of water, leave aside the sound of water. But he will be thirsty and asking for some water to his relatives. The relatives will be fearful to come to this boy or girl. The girl will be thinking why they are not coming. See, such a painful thing. That Utkata, which I was telling, he simply was waiting for the final verdict. He was counseled by the postgraduate, by the pharmacist, everyone. He had some hope that, okay, now the doctor will come. Poor me. I also said, why did you do? He was sure of his death. In front of me, mind you, he wiped the sindoor of his wife, telling that, now, you are a widow. You see what a pathetic death. So in rabies, it is always better to overtake. So these are the various, but don't treat it in case of a snake bite or anything. Right? For snake bite, we have to give ASBS as soon as possible. Right? But otherwise, if there is a question of a wild rodent, domestic rodent, Rattus norvegicus, remember the part of medical entomology of your textbook of parts, right? Rattus norvegicus, whose tail is longer, whose snout is smaller, written, which you had read once upon a time. I don't know if you have read now or not, but you had read. For them, fine. But if there is a history of wild rodent, go for anti-rabies. Who tells you not to do so? Right? So these are the animals which transmit rabies. Clinical feature, we know rabies manifest in two types. One is the typical feature of encephalitis, which has the typical characteristics of rabies. The three things which follow each other. First, photophobia. Right? Second, aerophobia. Third is hydrophobia. This is the sequence. Photophobia, aerophobia, hydrophobia. Typical feature. It is present in about 80% of the cases. However, 20% of the cases have this paralytic type, which are typical features of viral encephalitis. Seizure, coma, right? 20% occur in this form, where the features, characteristic features of hydrophobia, aerophobia, photophobia will be absent. And these usually occur in children. This paralytic type usually occurs in children. So whenever you get a case of a child with a provisional diagnosis of viral encephalitis, please ask for the history of exposure. Was he or she bitten sometimes back? Because it could be a paralytic type of rabies. And without knowing, you will be intubating, you will be putting the nasogastric tube, the child will be throwing everything, saliva is contaminated, and you are open. So in viral encephalitis, especially in children, please ask for an exposure, because that can occur in 20% of the cases. So these are the typical cases which you can see: ignorance, poverty, faith in all the systems in the world except allopathic system. Because nowadays you must have seen in the community, all are doctors except the doctor. Right? Isn't it? A tea shop owner can say, "Oh, we are having pain in the abdomen, gelusil, rhapsody, and fever paracetamol." They are the best doctors. Because if they come to us, "Oh, you are having pain in the abdomen, let us see where, ultrasound, X-ray." Why go to a doctor first? So everyone now is a doctor except the doctor. So they do everything except taking preventive care. So that is these are the unfortunate cases, and from the looks of them you can see illiteracy, poverty, ignorance, hydrophobia, aerophobia, typical features of rabies. You see, once I got a case at a child of about reading in 8th class or 9th. He came in the night at about nearly 9:30 p.m. I had closed my chamber. My father is a pediatrician. He called me, "Arey, a child has come with a dog bite." Right? I was also, we should not be tired. Right? A doctor could not be tired, cannot be tired. But anyway, I said, now a case of dog bite. Because I have to see, I have to give the vaccine, I have to give the rig or map. It will take time. So I was, okay, come in. I went into my chamber, put the light, switch on the fans, sat on the chair, and then I called him, "Hey, come, why are you making late?" He came with his father. The father entered. The boy entered, put a step on my clinic, and said, "Listen, sir, I knew it as a case of hydrophobia. I could not do nothing. Right? And I did not have the courage to tell him. I told the father only, why did you let this happen? Right? Ninth class boy, na? He knows everything. If you speak in front of him, कि rabies हो गया, कि that boy will die, he remembers. And just by that point, when he pointed at the fan, I knew it is already a case of aerophobia, hydrophobia. That's the reason. Right? So these are the features, painful features which you will face if you have not prevented the disease from the first place. So how to prevent? For that, we need a classification of the exposure. Previously, those who are, you are at my age, or are young, I think I am the oldest person standing here. When we used to read part 12th edition, 10th edition, now it is 20. I have to read. Now I am not reading. And why should I read? I am a professor and HOD of community medicine. Now I am a poor medical superintendent. No need to read, man. Here in this court, I only have to explain, counsel, escape from the work of the patient. Isobed, sure, I'll see. But these are the typical things now we have to tell. So previously it was like that. Class 1, class 2, class 3, number of bites, if a bite is lacerated or not, if a bite is on a highly innervated area or not. It was class 1, class 2, class 3. Now WHO has revised it into category 1, category 2, category 3 exposure. That's it. No class. Category 1, category 2, category 3. And please don't write on the prescription history of cat bite, cat 3. Please write category 3. We have the habit, na, cat 1, cat 2, cat 3 in RNT, NTEP. So history of cat bite, cat 3. So where are the first and second cats? Everyone will be wondering. Right. So category 1, just coming in contact with an animal without any injury. No need of treatment. No need of treatment. Right? Here we do not need the treatment except if that particular fellow is a doctor. Because the most difficult case to treat is a physician. The rest of the community are easy for us to treat. Right. To treat a doctor is very much time consuming, tiresome. You would want to say something, but due to behavioral characteristics, you will be telling something, the rest you will be swallowing them up. Right. So in cat 1, no treatment except a doctor, because I'll tell you a fact. One day, a reputed physician came to me, Durga, what happened? You see, I was going on a morning walk and a dog just passed over my feet. I think I should take it back. He said, no, he jumped on my feet and went, sir, you are wearing a shoe. Huh? Because Loto, bhai, Loto or Nike like that. You are wearing Nike or Loto. Is there any abrasion? No, I don't think so. I prayed and saw everything. But there is no abrasion, there is no injury. But category 1, sir, don't worry, no need to take it. But I had an injury about 2 months back. Sir, where? Somewhere on the feet. Anyway, that has healed. Suppose it is on the healing process. It takes time, na, 2 to 3 months. So it was supposed to be not yet be healed. There will be some dry area. I thought you take the and money you will pay. So how should I worry? You take the food. So especially cat 1, no need for this. But if it is category 2, where there is an abrasion without bleeding, that means it is not transdermal in nature. The exposure is not transdermal in nature because blood vessels are below the dermis, na? They are not in the dermis. So if it is simply an abrasion without bleeding, it becomes category 2 when only vaccines are given. You give the vaccine. But if it is a transdermal exposure where there has been some bleeding, it becomes category 3, where both active and passive immunization has to be carried out simultaneously. We know that in some exposures, both active and passive immunization has to be carried out simultaneously. Like tetanus, like diphtheria, like this. If it is category 3, there is bleeding, classify it, start the active immunization, also give the passive immunization. That is a must. Right? Of course, there will be instances when you write the prescription and tell them you have to take passive, they will again revert back. So actually, there was no bleeding. Acha. Oh, you did the transdermal exposure. Don't worry. Don't take a risk. Category 3 means category 3. You finish your prescription. To procure the drugs is their duty. If it is in government setup, free. Everything is free of cost. Private setup, it is their duty to bring. Otherwise, what happens? Now, I told you, rabies is 100% fatal. If tomorrow something happens and looking at them, you say, ki, poor fellow, dikhta hi poor. Why write immunoglobulin? And something happens, unfortunately, which is 100% fatal. At that time, they will pounce on your neck. Sir, I would have sold my house, utensils, everything. I would have got. Have you written? It amounts to medical negligence. Right? So please, if it is category 3, go for both active as well as passive. You see, that is why I am pointing out. They say it is a bad bite. So it is an ugly bite. We are looking at a bite, we are not looking at a girl. Right? We are not choosing who will be the Miss India. We are looking at a bite. So this bite, that small bite, wherever. Bite with bleeding, category 3. No question of ugly bite, beautiful bite, fair bite, black bite, nothing like that. Okay? Bite is a bite, transdermal or not. So, and this is what we mean. The 3 pillars on which the entire process of prevention of rabies is concerned. 1, local care of the wound, passive, active. The tripod. Local care of the wound has to be done. This is what we have to teach to the community. Because that they have to do after a bite, after any exposure, that is that they have to do at the community level. We have to teach them what to do. Then passive and active immunization. As far as the first step, local care, wash the wound thoroughly but gently. We have to wash the wound thoroughly but gently. We cannot go for a scrub, because more we scrub, the more the chances of exposure of the nerve endings. So we have to wash the wound thoroughly but gently with soap and water. So there are questions again. Sir, which soap? Lux? You are going to wash a full by 2. You are not going to wash your face. Right. What we need is carbolic acid, isn't it? And the second point is we have to decrease the surface tension by the detergent effect, by which the virus will die there itself, because it is a lipid capsule, na? Bull except virus having a lipid capsule, surface tension has to be decreased. It will die as a mechanical removal. Wash the wound thoroughly but gently with soap and water. Then apply a virucidal agent. Here we are not worried about the virus. And of course we have to go for wound healing. But in the first instance, we are worried how to destroy the virus at the site of bite. And the virucidal agents are povidone, chlorhexidine, or 70% alcohol. These are the virucidals for which we usually scrub before any procedure, surgical procedure, with spirit betadine. Isn't it? We do that. That is what we want to say. Apply a virucidal agent. And again, I will tell you, if you say this, we wash it with soap and water, apply a virucidal agent. So like a povidone give. People are fond of asking for everything. Na? When you go for a survey, they will say, okay, first ask, have you sent for calculation of our BPL status? Rice, how much kilo rice you will give? No, we are going to go for a survey regarding mass drug administration. Have you taken it? Oh, that one. We have taken. No. So whenever you ask or request someone in the community, they will say, Covidonite. Excellent, sir. Give. Fluorescent. Excellent. Give. You won't be carrying it. Alcohol. Give. Why? You may not be having povidone. I agree. You may not be having chlorhexidine. I agree. But in the land of the famous Mahatma, I do not agree that there will be a place where this will be the absent. Alcohol will be present in each village. Right? The only thing is they have to pour the alcohol on that orifice, not in this orifice. The orifice changes. Otherwise, you do that. First, local care of you. Okay. Then comes the other two aspects. That local care reduces the viral load. The other two induce systemic immunity. And for this, immunization. Passive or active immunization, no? Passive immunization or active immunization. This we have to do. Why? The rationale for giving passive immunization in the animal bite exposure category 3, because we know that active immunization is a process, and from your microbiology days, you know active immunization has various phases: lag phase, log phase, plateau phase, declining phase. Isn't it? These are the phases now. We give a vaccine, it doesn't mean that tomorrow we will be having two things: appearance of antibodies in the body, seroconversion. But we want seroprotection. Seroprotective level of antibody is 0.5 international units per ml. And to achieve that, it has to go through a lag phase. Then it will go to log phase. During the log phase, it will cross the seroprotective mark. And to cross the seroprotective mark, it takes minimum 10 to 14 days. So for 10 to 14 days, we are having the virus at the site. It is not killed. Though we may have given 037 free vaccines. But seroprotective level of antibody has not been achieved. So for that reason, if we leave it for 10 to 14 days, the virus has a chance of entering the nerve ending. And once it enters, nothing can be done. It escapes the blood-brain barrier. That is why we have to give passive immunization. Right? By that, commonly used heterologous, ERIG, homologous, HRIG. Now we are having synthetically prepared monoclonal antibodies against rabies. Right? MAB, RMAB, rabies monoclonal antibody. We are having that. Okay, these are the three types. Heterologous, available in the government setup. Homologous, human, HRID. Weight is per kg body weight dose is 20 international units per kg body weight. Average Indian, not like me, I'm a bit obese, right? मेरा है ना, so I am more than 70. But average Indian is say 65 kg. 65 into 20, 1200 odd units, right? Each vial of 2 ml contains 300 units. So for 120 units, we have to have 4 vials. 300 into 4, 1200 units. Na? Each vial costs only 5,300 rupees. Multiply it into 4. It comes to. So whenever you see a dog, just remember my face. Don't get exposed. Otherwise, Dr. Durga will write a prescription of hardly only 20,000. Okay. So whenever you see a dog, remember my face. But don't consider my face as a dog. Okay. I do not have a dog face. That's what we have. The passive immunization. Administered only once, as soon as possible. We can administer up to 7 days if active immunization has already started. 03 up to day 7, not on day 8. Because we have some places where this passive immunization may not be available in places. In those situations, 03 up to day 7, you give. Because beyond day 7, if you give, it will hamper the active immunization process. Right? So up to day 7, you can give, and as much as possible and anatomically feasible at the site of bite. Right? Because we know why we have to give it at the site of bite. Because we know that this virus is a neurotropic virus. It is not bloodborne. It won't cross the blood and spread, leading to viremia. No, it remains at the site of bite, just waiting within the myofibrils, just waiting to enter into a peripheral organ. So we have to give it at the site of bite, as much as anatomically feasible. Mind you, there are sites, the dose may be about 6 ml, but we cannot even give more than 1 ml. Bite, hands, nose, earlobes, tight compartments, isn't it? You cannot even give more than 1 ml. And people usually say to me, poor me, I usually get scolded. Very often. That too. Sir, the dog bite was not painful. Coming to you was painful. Like I have bitten. When I give the injection, they will be jumping. That dog bite was good, sir. But you are the worst person. You are giving the injections in such a way as if he is or going to die. If I do not give, you are definitely going to die. But I cannot tell like that also. Okay. As much as possible to give it. Rapidly neutralize the virus. Local protection up to 7 to 10 days, as I said, because the seroprotective level of antibody to appear takes about 10 days. So that's what it happens. And this is how they protect. The nerve endings are there, the viruses are there, the antibodies try to prevent the virus into entering into a nerve ending. That is the mechanism, and that is why we have to give as much as possible and anatomically feasible at the site of exposure, nowhere else. And infiltrated locally neutralizes the virus, should be administered as soon as possible. These are the various, as I told, ERIG, HRIG, and the MAB. These are the weights and everything. And these are the various passive immunizing agents available in the market. And you have to give at the site of bite. Okay. Then comes the vaccine. Nowadays, we are only having cell culture vaccine. There is no not tissue vaccine from 2004 onwards. In the meantime, we had a PDEV, purified duck embryo vaccine, which is not a cell culture vaccine. Now all the vaccines are cell culture vaccines, and mainly either PCEC, purified chick embryo cell vaccine, or PVRV, purified vero cell vaccine. We are even not even having HDCV, which we used to have the concept human diploid cell vaccine. Now only PVRV and PCEC are available. So method, again, there are two routes, IM and intradermal, which is the public health cost-effective way of active immunization, which we give. Intramuscular, we use the SN regime, 037, 14 and 28. Intradermal, the diagram we do not use here in India. In intradermal, you use the modified TRC, Thai Red Cross Society. Dr. Henry Wild, who I was speaking about in the first, he don't say 100% preventable. Dr. Henry Wild, he has developed this TRC. He belongs to the Thai Red Cross University. TRC regime, which is there, Oxford, we do not use in India. TRC regime 22202. 037, 14 is obsolete, and day 28. 2 sites per vaccination. The short course regimes which we have. Another we are having 222, we haven't implemented here. It is under trial. There is also another short course vaccination of 444, 1 week over 4 sites. Deltoid to suprascapular. Right? 4 sites. 444, 1 week regime. We have not yet been licensed in India. We are going for that. These are the another vaccine which we have is a G protein vaccine. Again, synthetic, just like MAB. This is also a synthetic vaccine. Wherein the G protein, which you know, the bullet-shaped virus has spikes. The spikes are G protein. Any antibody towards this G protein will lead to destruction of the virus. The G protein is now there, synthetically developed for a vaccine. And as the vaccine has a high concentration of G protein only 3 doses, 037, over. So this is another new concept which has developed. Recombinant MAB, as I said, recombinant DNA technology, hardly any reactions or anything. And approved regime, SN, and ID modified TRC, which I told you. So the only thing is, we have to remember, we should not suture the wound. If suturing is essential, then first infiltrate the rig or passive immunization, then go for loose sutures, not this typical surgical sutures. Right? So loose suturing can be done only after infiltration of passive immunizing agent, not before that. 1 week regime, which I was telling you, it is not yet implemented in our country. Awareness generation for 0, deaths due to human rabies, especially dog-mediated human rabies by 2030. Awareness. As I told you, local care of the wound has to be taken by the community. So we have to reach the community in making them aware regarding local care of the wound. ABC program will be better told by them. I am quite, though I know something, but unlike you, sir, you are the best person to tell. ABC program, vaccination, pre-exposure anti-rabies vaccination among high-risk population. I have taken pre-exposure anti-rabies vaccination, maybe 3 times. First I took 0721, forgot to take the booster after 1 year. Again repeated. 03 I took, I thought it will be enough as re-exposure. I left the 7. Then I said, I hadn't taken post-exposure, I had taken pre-exposure. Again I started pre-exposure. 037. First year booster, sincerely have taken it. Fifth year booster, again I have gotten. So anyway, the number of vaccines, anti-rabies vaccines I have taken, I think my body will be full, saturated with antibodies. Because 3 times I have taken. So that can be a possibility of taking. The last thing which I want to highlight here is because our friends from veterinary science are also there, and I am also a dog lover. I have 5 puppies along with their parents. That is a parent, first generation, then their children, so they are 4, and these 2 have another 5. So hardly 9 puppies I have. So for this reason, what I want to say is protect me first, because he dies of rabies first. Observation of the dog for 10 days. Why do you say? Right? That is another important and foolish question when you ask the patient. अच्छा आपका कुत्ता ठीक है? कुत्ता तो ठीक है, पर तू इंजेक्शन देना. कुत्ता ठीक है, हमको तू. So great thing, because he dies first. So you better save him first, because kill the best friend. Okay. Thank you. I hope I have. Thank you. Yeah. Thank you.
Thank you so much, sir, for your enlightening session, engaging and most hilarious. Thank you so much.
Thank you. Now I'll be on the road.
We
Back to
will,
office.
we'd like to take few moments to felicitate you, sir. Please accept our vote of
ठीक है ना?
gratitude.
अरे मेरे वाला कहाँ है? Okay, है तो. I'll take that. I won't leave anything.
So I would like to call Dr. P.V.K. Subbarao, sir, Associate Professor in the Department of Community Medicine, and I would like to call Dr. Sailahari ma'am, who is observer for today's session, who is a professor in the Department of Psychiatry, to join for the felicitation. Even I would like to call Dr. Nayak, sir, who is a retired DMNHO. Please come, sir.
And my bouquet also. I take this also.
already. And what's sir? Yeah, sir, I know, sir. Excuse me, sir. Excuse me. Sir is going to start the session. Please come. Fast. We are very fortunate to have you here, sir, because we are addressing across the disciplines. He is from the most important, that is environmental thing. I think most of us doesn't have that much clarity over the most of the environmental determinants. Okay, just I want to say a few words about sir. Sir has done his PhD on North. Sir has done his PhD on Northeast monsoon rainfall over South India and undertaking postdoctoral research as a fast track young scientist funded by the New Delhi and as a senior research associate. And he has done so many research work in the field of meteorology and climate changes. And his work includes 21 international research papers and 4 national papers and 58 research presentations at various conferences and seminars. Very nice to know, sir. He has published many journals. So he got a best poster presentation at a national seminar on tsunamis and other natural hazards over India in Andhra University in 2005. He also served as a reviewer for 3 international journals. Presently, he is serving as an adjunct professor in the Department of Meteorology and Oceanography, Andhra University, Visakhapatnam. Yeah, very much pleased and feeling pleasure, sir, to have you here. You can start your session, sir. Thank you, sir.
Thank you so much, sir, and sir, ma'am, for inviting me to deliver a lecture to the young generation of Indian democracy. Good afternoon to one and all. Myself is Dr. Rao, as he already introduced about me. I received Fast Track N Scientist Award from Government of India on the topic Northeast Monsoon in the year 2008. After the successful completion of my PhD, the Government of India provided me a research project on Northeast Monsoon. Northeast Monsoon is essential for the only one state in South India, that is Tamil Nadu. Tamil Nadu is unable to receive huge amounts of the rainfall during the prime rainy season, which is lasting June to mid-September. That information I can show you on far with the what type of diseases is developing in the recent times because of the global warming and climate change. This is my brief outline of my presentation. My topic is on effect of climate change on human health, a meteorological perspective. As I already said to you, I done my MSc and PhD on monsoons. So that's why I add that tagline, a meteorological perspective. My dear participants, you know, sun is the ultimate source of energy. The atmospheric conditions, those are changing daily because of the solar radiation. We can't imagine if there is no presence of the solar radiation, we can't imagine the present type of weather conditions that takes place on the Earth's planet. So that's why we consider sun is the ultimate source of energy. Weather is a day-to-day weather atmospheric conditions. As I said to you, weather is atmospheric conditions variations on shorter time periods. Actually, what is meant by atmosphere? Atmosphere is defined as a mixture of several types of the gases. I will show you in one of the coming slides about the mixture of gases those exist on the Earth's planet. Now, the definition of the weather is the variations of the atmosphere on day-to-day conditions, means short period time variations. For suppose we would like to say what is the weather, what is the atmospheric conditions over Srikakulam today, we have to use the word weather, not try to use the word climate. Those two seems very nearly close, but the definition is little bit vary. Weather means the changes of the atmospheric conditions on day-to-day conditions. For suppose that today's atmospheric condition at Srikakulam is fair weather. Never supposed to use the word climate. If suppose we would like to use the word climate, then the climate over the over Srikakulam in the month of November is little bit cooler when compared with the summer months. At that time, you use the word climate. I hope you have understand the difference between weather and climate. Both that seems the same, but we have to use timely. If suppose day-to-day weather atmospheric conditions is defined by weather, whereas long period weather conditions is defined by climate. Please, next slide. Yes, this is the climate. See, this is the monthly. This is the monthly rainfall over the globe, and this is the mean monthly temperature over the globe. My dear student participants, you know the Earth's average temperature is just 14 to 15 degrees centigrade only. If suppose there is no presence of the gases in the Earth's atmosphere, our Earth's atmosphere weather becomes very cooler, just like similar to ice age, what we have experienced long ago. Okay, so you always keep in your mind the presence of the certain types of the gases in the Earth's atmosphere is very much favorable to maintain the weather very frequent, very humble, very close. The Earth's average temperature is 14 degree centigrade. Next slide, please. Now, differential heating. You always remember that differential heating is the fundamental mechanism for the occurrence of the monsoons on the Earth's planet. Differential heating. What is meant by differential heating? As I said to you, sun is the okay. Thank you. Differential heating is the fundamental mechanism for the occurrence of monsoons on the Earth's planet. What is meant by differential heating? As I said to you, sun is the ultimate source of energy. This radiation is received by both water bodies and land regions. But because of the difference of the heat capacities of land and oceans is absorbing more amount of the solar radiation because of the heat capacity. The heat capacity of the water is approximately 1, whereas the heat capacity of the land is 0.01. Heat capacity means the amount of heat the object can hold is simply called as a heat capacity. As a result of that, temperature differences occurrence takes place in between land regions and surrounding ocean regions. During the daytime, the ocean region is cooler when compared with the land region. As a result of that, the winds, high pressure zone is occurred over the land region. So that's why the winds are moving like this. This is called sea breeze. During the night, the land region is getting cooled very faster when compared with the oceans. So the wind is transporting from oceans to land. This is called land breeze. This is called sea breeze. Sea breeze occurred during the daytime and land breeze occurred during the night times. The sea and land breezes, those are occurring on the larger spatial scales, simply called as a monsoons. All of you understand, I hope. Land and sea breezes are occurrence are takes place because of the differential heating. Land and sea breezes on the larger spatial scales is simply called as a monsoons. This is the world monsoon regime, which was designed by the great scientist C.S. Ramaz. He is one of the familiar scientists in my field. This scratched area countries is receiving copious amounts of the rainfall, but no other country, when, like India, is unable to receive huge amounts of the rainfall. You have an idea? India is receiving regularly 89 centimeters of the rainfall during the time period 1st June to September. No other country in the entire world unable to receive huge amounts of the rainfall like India. Even though these countries are receiving, but India is the dominant one. These scratched areas countries are receiving good amount of the rainfall. Coming to India, based on monsoon, there are 4 seasons in India. Winter, January and February, western disturbances. In the next slide, I will show you the animated pictures of western disturbances, thunderstorms, and prime rainy season, southwest monsoon, which is lasting June to September. No other country in the entire world unable to receive 89 centimeters of the rainfall within a time period of 120 days. India is the only one country which receives huge amounts of the rainfall. But unfortunately, in the recent times, because of the both global warming and climate change, the Indian prime rainy season is also disturbing on par with others. And the last one is post monsoon. As I said to you, my PhD is on northeast monsoon, which is lasting from October to December. The main synoptic scale systems are cyclones, easterly waves. We have very much familiar about the cyclones. In the recent times, for the last 1 week, 2 cyclones were formed in the southwest coast of Bay of Bengal. One is Senyar and the other one is Detwa. The forecasting of the cyclones is possible by the running of a numerical weather prediction models. Models means a set of mathematical equations is simply called as a models. ఇక్కడ అందరూ తెలుగు వాళ్ళేనా? మీకు ఒక స్టోరీ చెప్తాను మోడలింగ్ గురించి. జస్ట్ టేక్ ఇట్ లైట్. One of my main institute in our field is IITM, Indian Institute of Tropical Meteorology. Most probably 15 years back, a huge recruitment takes place for the positions of scientist B all over the India. One of the candidate has selected from the Assam for scientist B position in IITM Pune, Indian Institute of Tropical Meteorology Pune. For every scientist D or scientist E positions, there is 6 to or 5 members of scientist B positions. One of the candidate is allotted for doing the modeling. That person has approached. The guide said, go and learn modeling. The candidate replied, no, sir, I am not fit for the modeling. I am too short. You understand? The candidate is thinking that modeling means catwalk or some ramp walk. But coming to my subject, modeling means a set of mathematical equations. So the candidate is simply replied that the scientist D, Professor Krishna Kumar, when the candidate, newly joined candidate, approached him, just he said that go and learn modeling. You know, because of the modeling development only, now we are getting a huge amount of the information what will happen in the coming 100 or 200 years periods. Recently, Government of India has launched supercomputers, Arka and Arunika. With those supercomputers, we can get the very good information about the climate for the coming 50 years, 100 years, and 150 years, and 200 years with the help of concentration of carbon dioxide. This process is simply called as a scenarios. All these are possible for the successful running of mathematical models. These models are sometimes simply called as a numerical weather prediction. I hope you have seen about the occurrence or formation of low pressure over the Andaman coast, how it came to possible, because they are running the numerical models. They can know in advance, 3 to 4 days in advance, at that particular zone or at that particular grid region, there is a possible for the formation of a low pressure system. Once the low pressure system is formed, this one. But coming to the post monsoon season, this low pressure system is developed into cyclones. Both are the same synoptic scale systems, but depending upon the duration, June to September, we are simply call it as a lows or depressions. 4 closed isobars, such type of mesoscale systems, is simply called as a depressions. Intensity is little bit low when compared with the cyclones, but cyclones contains up to 6 closed isobars. Isobars means equal pressure lines. In the coming slides, I will show you. This is the western disturbances. Western disturbances are coming from Afghanistan and hit the Rajasthan, Punjab, and Jammu Kashmir. Next one is pre-monsoon thunderstorm activity. This is hitted over the northeast India, West Bengal, Assam, and some other regions, where the persons are calling the thunderstorms as Kal Baisikis or Nor'westers. Now this is the monsoon season. See, the winds are coming from southern hemisphere. Once they cross the equator, this is the direction southeast. But once they cross the equator, they are coming from southwest. This is happened because of the pseudo force Coriolis force. This Coriolis force is occurred on the Earth's planet because of the Earth's rotation. So that's why we are calling Indian prime rainy season sometimes as southwest monsoon, or as it happens in the months of summer. So that's why we are also called as a summer monsoon. Just imagine the winds coming from North Indian Ocean is spreading entire India and lasting up to 120 days and gives 89 centimeters of the rainfall. No other country in the entire world unable to receive such amount of the rainfall. Coming to the northeast monsoon, at the time of summer monsoon, this is the Tamil Nadu region. As here the Western Ghats presence are there, so these Western Ghats act as a rain shadow region to the Tamil Nadu region. So that's why Tamil Nadu is unable to receive good amount of the rainfall when compared with the other states of India during the prime rainy season, summer monsoon. So in order to fulfill that post monsoon, which is coming from northeast side of the Indian subcontinent, is giving good amount of the rainfall to Tamil Nadu. Tamil Nadu receives 48 centimeters of the rainfall for a days of 90 days, October to December. Just see how the summer monsoon is spreading over the entire Indian subcontinent. It takes hardly 1 minute, please. As I said to you, winds coming from southeast side. Once they cross the equator, this is the ITCZ, Intertropical Convergence Zone. This is sometimes called as a series of convective clouds. Convective clouds only can provide good amount of the rainfall. There are different types of the clouds: cirrus clouds, higher medium clouds, and high level clouds. But apart from those, the convective clouds only can provide good amount of the rainfall. The series of convective clouds is simply called as a intertropical convergence zone. మనకి తొలి ఏకాదశి, వైకుంఠ ఏకాదశి అని ఉంటుంది కదా. తొలి ఏకాదశి అప్పుడు ఇక్కడ ఉంటుంది ITCZ in the month of July. This ITCZ is coming to the equator in the month of January. వైకుంఠ ఏకాదశి రోజున ఇక్కడికి వచ్చేస్తుంది. See, once this is crossed, southeast winds crossed the equator, they are like this. As I said to you, this is the Western Ghats. Because of this Western Ghats, it acts as a rain shadow to the Tamil Nadu. Here is the Tamil Nadu is situated. Once they crossed, these southeasterlies are split into two branches. One is Arabian Sea branch and the next one is Bay of Bengal branch. If suppose there is no presence of the Himalayan barriers here, the northeast India, which is the rainiest area in the entire world, unable to receive good amount of the rainfall. I hope you have heard about Masinaram and Sirapunji. This is possible because of the presence of the Himalayan barriers. If there is no Himalayan barriers, these winds are traveled up to Siberia. So the persons who are residing in the northeastern countries, they are call it as a deflected monsoon. ఇక్కడ చూసారు కదా మీరు అందరూ ఇలాగెళ్ళింది మా winds. They are not supposed to call as a southwesterlies, even though it is come from the southwest side. But the people who are residing in northeastern states, it is called as a deflected monsoon. Why? The Bay of Bengal branch winds is hitted to the Himalayan barriers and reflected back. So that's why they are called it as a deflected monsoon. Now, unfortunately, the Indian monsoons are affected by the climate change, global warming and climate change. Svante Arrhenius is the father of climate change. He first time predicted in 1896 about the atmospheric carbon dioxide levels. Before the pre-industrial time period, before that means 1750, the concentration of carbon dioxide is 220 ppm, parts per million. Now, the concentration of carbon dioxide in our Earth's atmosphere is 440. That much concentration of the carbon dioxide increase takes place because of the industrial revolution. That information was first predicted by Svante Harihinius. So that's why he is treated as a father of climate change. The carbon dioxide levels is increasing the surface temperatures. Increase of the surface temperatures is nothing but a global warming phenomenon. Because of the global warming, climate at a particular locations is changing. All of you understand? Global warming is different and climate change is different. Global warming is a worldwide phenomena, whereas climate change is a regional phenomena. Because of the increase of the global temperatures, the climate over the Indian subcontinent is changing, especially coming to the formation of monsoon depressions. That information I can show you in the coming slides. Yeah. See, 0.8 degrees centigrade. As I said to you, Earth's mean temperature is lasting 14 degrees centigrade. But right now, it is accounts up to 16 or sometimes 17 degree also. It was happened after the Industrial Revolution that takes place 1750. Yeah. This is the quantity of the Arctic ice. Because of the increase of the temperatures, the Arctic ice is shrinking. Just look into this, 1990. Yeah. Climate is on a range of decadal, centennial, and millennial. Okay. Weather is only instant, day to day. But climate is on a time scales of decadal, 10 years, centennial, 100 years, and millennial, 1,000 years. Now, how the climate change alter the Indian monsoon and how the Indian monsoon is affected with increased extreme weather events. In the coming slides, I will show you. This is the monsoon core region within the Indian subcontinent. This region receives huge amounts of the rainfall when compared with the other regions. This Northeast India is the world's wettest region. No other region in the entire world unable to receive 89 centimeters annually. But because of the climate change, there is a decline of 0.5 to 1.5 mm per day for the decades 1951 to 2024. So for that reason, recently IMD has remodified the definition of Indian summer monsoon and strictly confined to 84 centimeters is enough to define a very good monsoon, poor monsoon, or below average rainfall. That type of information they can take depending upon whether the monsoon was recorded with 84 centimeters or not. It is enough. They have decreased 5 centimeters of the rainfall. Why they have decreased the 5 centimeters of the rainfall? Because bankers can sanction the loans depending upon the performance of the summer monsoon only in the entire India. You know, finance minister every year he or she going to present the finance budget to the government of India. She quoted, my finance budget is based on the performance of the Indian summer monsoon ensuing. Okay, that much importance they have given. But because of the global warming and climate change, once upon a time, the Indian subcontinent is received 89 centimeters of the rainfall. But 2009 onwards, Indian subcontinent is receiving only 84 centimeters of the rainfall. This was happened because of the disappearance of the monsoon low pressure systems, which was formed over the head bay of Bengal. As I said to you once upon a time, monsoon depressions form up to 7 to 8, but in the recent times, it is only 2 to 3. And even though monsoon depressions less, but intense downforce are quite common. Frequency is decreasing, but intensity is increasing. This was happened because of the increase of the surface temperatures. See, for every 1 degree centigrade, the atmosphere can hold about 7% more water vapor. Water vapor means is a form of a different types of the clouds, simply called as a water vapor. So warmer air, more moisture, and heavier rainfall. Heavier rainfall increases water contamination risk. These are the major health issues: dengue, chikungunya, waterborne diseases, respiratory infections, and eye infections rise to humidity. In the recent times, these are the quite common because of the intense rainfall activity that is occurring across the Indian subcontinent during the Indian prime rainy season, which is lasting from June to mid-September. This you have to remember. Climate change does not directly create diseases, but it creates conditions to spread diseases more easily. Scientists usually cannot say the percentage of increase only because of the climate change. It is affected by population growth, urbanization, water supply, and sanitation. We never supposed to attributed the increase of the diseases are strictly to climate change. It is also influenced by population growth, urbanization, water supply, and sanitation. This is a dengue trend in India. National Vector-Borne Disease Control Program from 2019 to 2023. The dengue is increasing. Warmer nights help Aedes mosquitoes so survive and breed faster. We are experiencing warmer nights. Because of this warmer nights, the Aedes mosquitoes are increasing. During the COVID time, we are less consumption of the fossil fuels. As a result of that, the concentration of carbon dioxide in the Earth's atmosphere is little bit low. As a result of that, the COVID cases in the year 2023 is just 0.45 lakhs. India reported dengue cases have almost doubled from 2019 to 2023. Globally, dengue cases are increasing from 10 to 12 times, and climate change had made conditions 10 to 12% more suitable for the dengue mosquitoes. Malaria. Actually, malaria is under control, but because of the increase of the warmer nights, these regions in the recent times is also recorded with the malaria cases. These are Himalayan foothills, Northeast India, some parts of Central and Eastern India. Even though the government of India has taken proper precautions to control the malaria, but because of the warmer nights and longer rainy seasons, these regions in the recent times is recorded with the malaria cases: Himalayan foothills, Northeast India, some parts of Central and Eastern India. Diarrhea and cholera outbreaks in India have increased roughly 3 to 4 times, are linked to monsoon-related contamination. These diseases are linked to monsoon-related contamination. Increasing extreme rainfall which raises the risk further. I can show you the extreme weather events in the coming slides. Cloudburst. Cloudburst means intense downpour of the rainfall within 6 hours. Actually, during the monsoon season, the entire Indian subcontinent for a duration of 120 or 110 days receives 89 centimeters of the rainfall. But because of the cloud bursts, which is lasting only 6 hours, a particular region receives up to 10 or sometimes 20 centimeters of the rainfall also. Such type of situations is simply called as a cloud bursts. These cloud bursts are occurring because of the thunderstorm activity. So that's why cloud bursts are very much familiar to the mountainous regions and interior land regions. Okay, not to the coastal regions. Mountainous regions. Health impacts: hypothermia, and leptospirosis. These two are the health impacts that was occurred because of the cloud bursts. Because of the cloud bursts, flash floods are taking place. The difference between floods and flash floods means flooding activity is gradually increasing, but flash floods is occurred within 5 hours, 6 hours, or 10 hours. One best example was occurred in the year 2010 by Leh. Just 255 killed, and the areas affected are Leh and other villages in Ladakh range. This is the cold waves. Northwest India, northern part, and northeast India, these states are affected with cold waves. If suppose the daily temperature is less than 10 to 0 degree, such type of situations is announced as a cold conditions prevail over northwest India, northern region, and northeastern states. Northwest India, northern India, and northeast. See, 0 to 10 degrees centigrade. India had 509 cold waves. Because of the cold waves, hypothermia, cardiovascular problems, joint, bone, and muscle pains. These are the diseases which are occur during the time of cold waves. Those are prevailed over the Indian subcontinent. Next one is heat waves. IMD is announcing the heat wave conditions whenever the temperature is 40 degrees centigrade for the plains and the temperature is 30 degrees centigrade for hilly regions. At these two situations only, the India Meteorological Department is announced that that particular location is hit by heat wave conditions during the summer season in the months of April and May. This type of conditions is quite common over the entire Indian subcontinent. Just remember this one. If IMD is announcing at that particular location he is hit by heat wave, at that time if the station is plain, that time the temperature, day temperature is greater than 40 degrees centigrade, and for hilly regions if the temperature is greater than 30 degrees centigrade, that time the IMD is announced that this region is hit by heat waves. More frequent and longer heat waves when compared with the 30 to 40 years. Yeah, it is real. And 2024 and 2025, parts of Rajasthan, northwest India, and Delhi recorded 49 degrees centigrade. They are the plains. 10 to 20 times higher in the recent times. During heat waves, the body fails to cool, leads to heat stroke, causes organ failure. Thermal stress and hypothermia. Urban heat island effect. Cities Delhi, Mumbai, Hyderabad, Bangalore, and Chennai become significantly hotter. See, rural areas are recorded with lower temperature because of the vegetation. Why it is necessary to plant a tree? You have any idea about the importance of the tree? Because trees are the responsible for the transport of potential evapotranspiration. Potential evapotranspiration means a small amount of the water is available at the root zone of a tree. That amount is transformed from root zone to up to the top leaves of the tree. At that place, the tree is entering some sprouts of the water sprouts into the Earth's atmosphere. This process is simply called as a potential evapotranspiration. You know, our Earth's surface is covered with 75% of the Earth's surface is covered with water, whereas the atmosphere contains only 0.01% of the water. But even though it is less, it is very essential in order to keep the world hydrological cycle in a smooth way. If suppose the concentration of the water vapor in the Earth's atmosphere is increasing, at that time cloud burst takes place. If suppose there is no concentration of the atmospheric water vapor in the Earth's atmosphere, at that time heat waves conditions prevail. This is defined by urban heat island effect. See, rural areas are recorded with lowest temperatures, and this is the cities. Cities are constructed with concrete. As a result of that, no vegetation. So that's why the temperatures are increasing. This is called as a urban heat island effect. Because of the urban heat island effect, faster dehydration, fatigue, and heat cramps. 600 to 2200, the deaths because of the urban heat island effect. This is the mixture of gases. Yes, 99% of our Earth's atmosphere is composed with two types of the gases, nitrogen and oxygen. The remaining 1% gases is mixed with several types of the gases. Within these gases, fewer gases are absorbed the Earth's emitted radiation, and later on that absorbed radiation is further emitted by the gases with more intensity. Such types of gases is simply called as a greenhouse gases. Among the greenhouse gases, ozone is the one. Ozone in the Earth's stratosphere is very much favorable for the human life on the Earth's planet. But ozone formation takes place at the Earth's surface is very much harmful. Ground level ozone formation is very much difficult in presence of light. Secondary pollutant, volatile organic compounds, and nitrogen oxide leads to ozone formation at the Earth's surface. In presence of the sunlight, this ozone mixed with nitrogen oxide and hydrocarbons leads to smog. These conditions are very much familiar over the northern Indian regions in the months of October, November, and December, especially over Delhi. These are the sources of volatile organic compounds, and these are the sources of nitrogen oxides. Factories are releasing volatile organic compounds and nitrogen oxides. Health impacts, coughing, burning, and for every 1 degree rise in temperature, ozone levels may rise to 1 to 3 parts per billion. ppb means parts per billion. The units to measure the ozone is parts per billion. Sometimes it is also called as Dobson units, dB. By 2050, many Indian cities experience 20 to 30% more high ozone days if emission continues. Until now, we have heard about the global warming. On the other facets, global cooling is also there. Yeah, global cooling takes place whenever the volcano eruption takes place. In the recent times, Mount Pinatubo erupted in the year 1991. It is the largest volcanic eruption of the 20th century. After eruption of the Mount Pinatubo, it enters huge amounts of the aerosols, sulfur dioxide. These aerosols act as a sunshade for the Earth. It acts as an obstacle to the incoming solar radiation. As a result of that, global cooling takes place. This caused a temporary global cooling for nearly 2 years. After the aerosols settled, temperatures rose back once again. So, long-term warming continued because of the greenhouse gases, not for the volcanoes. Natural activity is unable to enhance the greenhouse effect, but the artificial aerosols is increasing the global warming. Thank you. I know my presentation is little bit vary to your basic fundamental science, but I hope some of you have understand about what will happen in the field of meteorology and oceanography. Okay, Government of India is sanctioned 500 crores for the development of numerical weather prediction. Yes. Ah. Yes, plantation is very much only, and less consumption of the fossil fuels. Group cars is more suggestible by using their solar cars, transport facilities. Carbon monoxide is the very big one. Carbon dioxide, the lifetime of carbon dioxide in the Earth's atmosphere is 150 to 200 years. Yes, because of the presence of the oceans. Oceans is absorb huge amounts of the carbon dioxide. Mostly 770 petagrams of carbon dioxide is absorbed by oceans, whereas the Earth's atmosphere contains only 1 to 2 petagrams. Even though the atmosphere contains 1 to 2 petagrams, this much amount of the heat we are experiencing in the recent times, especially from the industrial revolution that takes place in the year 1750 onwards. If there is no oceans, our atmosphere is completely closed. That much high weightage the carbon dioxide has. It contributes huge amounts of the temperatures. The lifetime of the carbon dioxide is 150 to 200 years. Whereas methane, this gas is also released by the animals, rats. But the lifetime of the methane is 11 years only. We can control the methane release, but we are unable to control the release of the carbon dioxide.
Sir, I have a question.
Yes.
Sir, because of due to global warming, we have adverse weather conditions globally. So, because of which the respective governments of every nation has to take some protection measures. So, how can we, like, is there any indicator or something like to measure? I mean, like to evaluate and to compare the, I mean, like evaluate and compare the climate protection
Yes.
measures taken by the governments.
Yes. Now, previously, Montreal Protocol in Brazil in the year 1990. Montreal Protocol is to control the release of chlorofluorocarbons from by the usage of air conditions and refrigerators. You know, in the recent times, we are seeing one sticker is attached to the ACs and refrigerators, CFC, chlorofluorocarbons free. That technology was developed as a result of that. In the southern hemisphere, Antarctic hole is closed. I hope you have seen several in print and electronic media. This was happened after the accepting of the Montreal Protocol. Later on, after the successful of the Montreal Protocol, they moved to the Kyoto Protocol, which was takes place in the early 2000s. But just like similar to the Montreal Protocol, Kyoto Protocol is unable to success. Why it is because we are constructing more number of the buildings, and at the same time we are using large scale transport facilities. As a result of that, we are unable to control the release of the greenhouse gases entering into the Earth's atmosphere. Even though the Kyoto Protocol is not succeed in the recent times, I think we have heard about COP Conference of Parties 30. That is came into force. This is also not suitable. America is the only one country which receives huge amounts of the carbon dioxide concentration into the Earth's atmosphere. With Telugulo విషయం చెప్పనా, America got independence 250 years back. You just imagine, since 250 years back, huh, no lady was elected as a president of America. What is the reason behind it is? Women are very sensitive. అందుకని వాళ్ళు ఈ గ్రీన్ హౌస్ గ్యాసెస్ రిలీజ్ అవుతున్నాయి కాబట్టి కంపెనీస్ మూసేయంటే వాళ్ళు సంతకం పెట్టేస్తారేమో అని చెప్పేసి అమెరికన్స్ అక్కడ ఉన్న వాళ్ళు ఎవ్వరు కూడా చూసారా, ట్రంప్ 2 సార్లు నెక్కినా సరే ఉమెన్ మీదే నెగ్గాడు, లేదంటే ట్రంప్ ఈజ్ అనేబుల్ టు ఎలెక్ట్. దే నో ట్రంప్ ఈజ్ ఈజ్ ఎ బ్యాడ్ పర్సన్, దే నో. బట్ They are never supposed to support the woman as the president of America. వాళ్ళు సంతకం పెట్టేస్తారేమో అని అక్కడ వ్రాసుకొని ఉంటారు. వైట్ ఆంగ్లో సాక్సో పిలిగ్రిమ్స్ దేర్ ఐక్యూ ఈజ్ వెరీ వెరీ గుడ్. వాళ్ళతో కంపేర్ చేసుకోగలిగే ఐక్యూ ప్రపంచంలో ఎవరికి ఉండదు. 255 years back they have written the constitution. వాళ్ళు అప్పుడే అన్నారు 8 సంవత్సరాలే ఏ ప్రెసిడెంట్ అయినా రూల్ చేయాలి అని. అంటే వాళ్ళు అంత ఫోర్స్ అయితే ఉపయోగించారు. జస్ట్ 250 years నుంచి వాళ్ళకి అమెండ్మెంట్స్ జరిగినాయి 3 సార్లు 4 సార్లు అంతే. మన ఇండియాకి మీకు నచ్చితే నేను నాకు నచ్చితే నేను మార్చుకుంటానే ఉంటాను. ఓకే, అలాగే ఉమెన్ సెన్సిటివ్ అన్నారని వాళ్ళకి భగవంతుడు ఏమి ఇచ్చేలా. మీరు ఎప్పుడైనా అబ్జర్వ్ చేశారా? బాల్నెస్ ఈజ్ అక్కరింగ్ ఓవర్ ఐలాండ్. ఉమెన్స్ కి ఎప్పుడైనా బాల్నెస్ చూసారా? ఎందుకు? ఇక్కడ ఉన్న టిష్యూస్ మాకు వీక్ గా ఉంటాయి, ఇక్కడ ఉన్నాయి స్ట్రాంగ్ గా ఉంటాయి. మాకు ఇక్కడ ఏ అయితే టిష్యూస్ ఉన్నాయో ఉమెన్స్ మొత్తం హెడ్ అంతా స్ప్రెడ్ అయి ఉంటాయి. చూసారా కాంపెన్సేట్ అయిపోయింది. మాకేమో 8 పొరలు ఉంటాయి, 5 పొరలు 4 పొరలు ఉంటాయి స్కిన్. అందుకే మీరు సెన్సిటివ్ అని చెప్పేసి అమెరికన్స్ రూలింగ్. అందుకే టోటో ప్రోటోకాల్ కావచ్చు, కాప్ కావచ్చు సక్సెస్ అవ్వచ్చు. వాళ్ళు ఎక్కడ వాళ్ళు ఫీల్ అయ్యి ఇందాక ఆయన చూపించారు కదా అలాంటి పిక్చర్స్ ఆఫ్రికాలో చాలా మంది ఉంటారు. వాళ్ళకి వాటర్ కంటామినేషన్, నీళ్లు కూడా దొరకవు. అలాంటివి చూసి వాళ్ళు సెన్సిటివ్ గా ఆ కంపెనీలు మూసేస్తున్నాం అని చెప్పేసి పిక్చర్ అనుకోండి.
So countries తీసుకునే క్లైమేట్ ప్రొటెక్షన్ మెజర్స్ ఉంటాయి కదా అగేన్స్ట్ దిస్ గ్లోబల్ వార్మింగ్. సో దాన్ని ఇవాల్యుయేట్ చేయడానికి, కంపేర్ చేయడానికి ఏదైనా ఇండికేటర్ లాంటిది ఏదైనా ఉందా?
yes IPCC, Intergovernmental Panel on Climate Change. Intergovernmental Panel on Climate Change. It is a voluntary body. IPCC is releasing assessment reports, AR reports, for every 5 to 6 years. At that time release of the assessment reports, they have announced that this country is responsible this much quantity of the greenhouse gases are emitting. As a result of that, this region is affected by the climate change. You know, IPCC is unable to announce the impact of climate change across the Bay of Bengal. As I said to you, the disappearance of the monsoon depressions takes place since 2009 onwards. But IPCC till now never supposed to announce Indian subcontinent is affected with the climate change. The reason behind it is any region is announced as a climate change affected by the IPCC, then World Bank is providing huge amounts of the funding for that particular nation. అక్కడ కూడా మనకి కొంచెం డిబేట్ చేస్తూ ఉంటాం. IPCC, Intergovernmental Panel on Climate Change. మీకు ఒక విషయం చెప్తున్నా. IPCC was founded by Rajendra Kumar Pachori, RK Pachori. He is from India, Nainital. ఆయన చీట్లోంచి ఎలాగైనా దించేయాలని చెప్పేసి వరల్డ్లో ఉంటారు కదా, అది ఎక్కడ దొరుకుతాడా అని చెప్పేసి చూస్తున్నారు. ఆయన ఓస్లోని క్లైమేట్ చేంజ్ ప్రోగ్రామ్ గురించి లెక్చర్ ఇవ్వడానికి వెళ్తున్నారు. ఓస్లో, స్వీడన్. ఆయన లెక్చర్ ఇస్తున్నప్పుడు ఎగ్నెస్ట్ క్లైమేట్ చేంజ్ అన్ఫార్చునేట్ గా ఆయన కార్ వాడారు. ఇంటర్నేషనల్ టాప్ రైడ్స్ ఉంటారు కదా, వాళ్ళు ఫోటో వేశారు. He is going to deliver a lecture against the global warming, but he used the petrol car. How he is suitable for the chairperson of the IPCC? Simply he resigned with that IPCC chair. Okay.
Thank you so much, sir. You have spoken through your long journey of experience. So, after that, without further delay, I would like to call Dr. Hemant Kumar, sir, who is a veterinary assistant surgeon. Please.
So, when I was a kid, whenever I fell sick, I used to go to the hospital, and the doctor took all the vitals, and he used to prescribe some medicines to me, and I used the medicine. After 1 week or 2, I recovered well. But at present, that is after 25 to 30 years, if I go to the hospital, the doctor, he has to take the vitals as usual, and we have the advanced diagnostic facilities. Apart from that, he's asking two more questions. Can you guess that? The stress factor. We are living in a society where there is so much of stress, right? Because he is asking about my sleeping pattern, how I am sleeping, the quality of sleep, which is indirectly linked with the environment in which we are living. And the second one is nutrition, what I am eating, and the quality of the nutrition. If you see, sorry, mostly our human nutrition comes from the two sources. One is a vegetable source, that means a plant source. Another one is a animal source. So if you see over the years, the population trend is increasing. We are almost crossing the population, already crossed the population of China also. So due to the demand to meet the production, that means to meet the requirement for the population, the production also need to be increased. So likewise, the production levels also increase. If you see, the production levels are pretty much increased when compared to the previous years, because there is so much revolutions, green revolution, white revolution. Every revolution, there is a increased production of food. But what happening for the production increase, to increase the production, they are using mostly, if you see in the agricultural perspective, they are using mostly pesticides and fertilizers, and those are directly coming into our plate. When come to the animal husbandry sector, the main food that comes from the three components, that is milk, meat, and egg. Even in the animal husbandry sector also, there is improvement of genetic material. Previously, a cow gives only 3 to 4 liters of milk. But now, if you see, there is a crossbreeding program that has occurred thanks to Varghese Kurian and Swaminathan. They did that revolution in the food sector, and drastically we improved crossbred population in the society, so that now can you guess the milk production from an average cow? How much? 20 liters. Okay. There is a cow that also giving 20 liters per day, but the average milk production is now 12 liters per day. So there is increase in the crossbred population when compared to the native cattle. And can you guess, the old people, they are much stronger than us, because their activity, their food habits, and the climate they live. When compared to you, your grandparent, he is more healthier than you. Why all this happened? Due to the increased demand in the food production, we are using growth promoters. To increase the production, there should be a less burden of pathogens. That means the disease profile should be low. So they are using antibiotics like anything. It will be surprise to you, because the antibiotic use in the humans is far more, in the animals is far more than human beings. And people are using in the animal husbandry sectors, antibiotics are like a chocolates. Whatever they want, there is no stringent actions, regulations. So why am I all saying is this? Because all the antibiotics and pesticides, fertilizers, all are coming into our plate, which indirectly affects our health. So our health is indirectly affected by the food we are taking, that is coming from the animal source. So animals indirectly causing some deleterious effects in terms of nutrition. Coming to the next slide, this is the data from OIE, Office International Epizootics. If you see, 60% of the existing human infectious diseases are zoonotic. The list is very big. Already we have told. Coming to the rabies, brucella, anthrax, teniasis, cysticercosis, whatnot. The list is very big. And 75% of the emerging diseases, they are also have an animal origin. If you see the HIV, SARS, and the recent COVID also, it's also having an animal origin. And out of the 5 new emerging diseases every year, 3 are from animal source only. And lastly, you have heard about the bioterrorism. Previously, they used in USA or something, they used anthrax spores. So many of you heard. They send the parcel of anthrax spores to the people where they want to destroy. That's also even 80% of the pathogens that are used for the bioterrorism are also having a zoonotic importance. So what I want to say is, a human health is directly and indirectly is affecting by the health of the animals. So in order to achieve a good health in the human beings, we have to collaborate. That is the need of the hour. So not only treating the human diseases, but also treating the animal diseases, and we have to treat the shared environment. All will cause the direct effect on the human health. That is the One Health. So today's topic is One Health, and I'm very happy. Madam just called me to have a lecture on the One Health, and this is the first time I'm giving the lecture outside from my department, and I assume this is the first step of collaboration, so that, and more of this should happen, because what is happening in my department nobody knows, and what is happening in the public health department or human society, that means human health, I don't know, because both are doing their jobs individually, but that is not the case, because most of the cases and most of the upcoming diseases, zoonotic diseases, are emerging and re-emerging diseases have an animal origin. So you people must have some knowledge on the animal health, so that we people can give a better society for the One Health. So good afternoon to all. It's already afternoon. My session is very small, so I won't take much of the time. This is Dr. B. Hemant Kumar. I'm a veterinarian. I'm working in the animal husbandry sector for the last 13 years. And I would like to share the role of veterinarian in the One Health. That is the today's topic. Already sir told, HOD sir already told the introduction, but to be in a smooth way, I'm also just giving a small introduction. One Health is a, thank you. One Health is a multidisciplinary approach. That means there is interconnectedness between the animal health and human health and environmental health. So if there is any change in the health aspect of these three, there will be a break. So that leads to either outbreak or a pandemic. So the core principle is the animal health and human health and environmental health are interlinked. So the effect of one, that means if one thing is affected, that affect other aspect also. That means if the animal health is compromised, it affects the human health. If the environment health is compromised, it affects the human health. So the core principle is we should protect the health of the main three components, and the approach should be as we know, we should collaborate. That means we should work collaboratively. Then only we can give a better society to the future generations, and our goal is rather working individually, we have to come together and we should work as a whole. Then only we can achieve the goal of one health concept. Coming to the history, this one health concept is not a new one. Aristotle, he is a biologist. He used to study the animals and human beings also. He noticed that whenever there is change in the environment, there is more incidence of diseases, and humans are getting diseases after they have bitten by the animals, either wild animal or pet animals. So he noticed that there is a connection between the animals and environment and human health. That is the first step of one health. Later, Rodolphe Vicho, we can say him as a father of one health. He termed the coin zoonosis. Zoonosis means the disease that are transmitted from the animals to humans. He first noticed that there is a connection between the animals and humans in terms of health. Then William Osler, he is the student of Rodolphe Vicho. He studied both the animal diseases and human diseases, and he wrote the book, The Relation of Animals to the Man. And in 1947, the CDC, Center for Disease Control and Prevention, it is a organization that is in the USA. It developed a wing, that is a veterinary public health wing, uh, because of the importance of the veterinary, that means animal husbandry, in terms of health of the humans. And Kelvin Schwabe, he is known as father of one health. He said that there is no separation, there is no separate line between the animal health and human health, because all are interconnected. So in order to get a good health or good living being, we should treat the animals and humans are invariably. So there are so many issues that one health should concern. Among those, these are the points. Already Salt covered this, so I'm not reading again. That is zoonotic disease, AMR, animal health, human health, environmental health, and occupational health, and more. So coming to my topic, rabies. Sir already elaborately told, but I'm just giving the veterinary perspective of rabies. So as you know, rabies is a highly fatal and deadly zoonotic disease, because in every year across the globe 59,000 deaths are happening, and the sad part is 35% is from the India only, because in India there are no strict or stringent measures to control the dog population. Every time you see the paper, any day there is a dog bite case. The dog bitten some small kid, and there is happened the dog bite. Even in my practice also, if a rabid dog enters into a village, it will randomly bite into the whichever it comes into the place. That means the tendency is that it will move, it will bite the thing or animal or human being, whichever comes in its way. It will bite almost all the moving things. So it will bite all the animals and spread the diseases. That is the main culprit. So when coming to the host, in India, as Sir already told, 99% of cases, rabies cases, that are occurring through the dog bite only. Because there are some wild animals, cats, civets, monkeys, raccoons, they're also harboring the virus. But in India, 99% of the cases are occurring through the dog bite only. So if we control the dog population, then we can easily achieve the transmission of the rabies in the humans. So for that, what we have to do? Before 2001, in order to control the dog population, people used to practice mass killing. If anybody gives complaint, they used to, the dog catchers are there, they used to catch the dog by using the strychnine poisoning or direct gunshot or some other euthanasia practices, safe euthanasia practices. They used to kill the dog, or they used to relocate the dogs. That means if there is a area where the dog population is very dense, they will take the dogs to some other place where there is a less number of population. But in 2001, according to the Article 21, some of the activists, they said that according to the Article 21, every living thing, that means every microorganism or everything which has life has a right to live on the earth. So unnecessarily, for our sake, we should not kill the animal. Even if you see the trophic level in the food chain, all of you might read that. If the dog population is reduced, even that means if there is zero population of zero dog population in the society, what will happen? In the trophic level, one species was eliminated, dogs. What will happen? There is a rise in the cat population because everything is interlinked. It is a chain. So we cannot eliminate as such, but we have to reduce the dog population. So the Supreme Court given a judgment that you have to conduct the ABC, that is an animal birth control program. In that program, we have to catch the dogs, we have to neuter the dogs, and we have to vaccine the dogs, and again we have to release the dogs into the same location only. You know, dogs have some territorial behavior. The dogs from one area, if you see, if the dog comes from another village or from the another colony, the dogs in your colony, they won't accept, because that is their territorial behavior. Either they will kill the dog or they will make the dog to run. So in the ABC program, they have to neuter the dog, they have to catch the dog, they have to neuter the dog, and after giving the vaccination only, we have to relocate the dog to the same place. Why this ABC protocol is much important? Dogs have 2 breeding cycles in a year, because in dogs, for every 6 months they come to heat, and the gestation period is 62 days. Within a 2 months only, the dog will give puppies. Do you know the litter length? Each dog will produce around, can you guess? 6 to 8, even 10 also there. But average, an average, a dog will give 6 to 8, because there will be a superpopulation. That is a normal feature in the dogs. So it will continue to ovulate for the 9 days, so that there is a superfecundity. So whichever the dog it mates, it will continue to ovulate, so that there will be number of puppies that will be born. So if a dog that breeds twice in a year with a litter of 6 to 8, means in a year, if a dog is there in one colony, it produces around 10 to 12 puppies. And the lifespan of the dog is 10 years, and it will come to the maturity in a span of 9 months. That is the last one. Mostly the maximum period is 12 months, that is 1 year. In a year, that will be matured, that will come to the pubertal stage, and that will be again producing number of puppies. So after 2001, where the mass killing was stopped, there is a enormous increase in the number of dog population. So in order to reduce the population, we have to do invariably the animal birth control program. That is the only option we have. But there are a lot of hiccups in the animal birth control program, because this program is funded by the government of India, and as well as other rural, that means administrative departments, that is municipality department. But it is not happening in the rural areas because of the budget constraint. See, in the Srikakulam, there is a ABC Annual Birth Control Center that is located in the Kazipeta, if you know. That is covering only the municipal area. The animals from the municipal area only, they are taking that, and they are doing the ABC operations. And that is also having budget constraints. So what about the rural area? We are getting a lot of grievances. In my village, a rabbit dog that killed so many birds, so many animals. So what can we do? If there is any incidence of killing a dog by a man, the animal activities, they treat that is as a big sin, because so that the controlling a dog population is very much important. So in near future, we hope that the dog population will come into control by the strict and stringent laws, so that every dog will be neutered, and it will be catched, it will be neutered, and there will be a post-bite vaccine. Post-operatively, it will be given a anti-rabies vaccination, and then it will be left to the same location. So in order to reduce the transmission of the rabies, we have to do vaccination. That is a mass vaccination program. So why mass vaccination program is very much important? If you see, there is a disease called rinderpest. You might have not known. Even I don't know, because it was eradicated in 2011, and the last case was reported in 1995. It is a devastating disease in the cattle. The animals which are affected with the rinderpest, there will be profuse and severe diarrhea, and there will be a lot of production loss, and eventually animal dies. So it was the second disease that was eradicated from the globe by means of the mass vaccination program. After the smallpox, this is the second disease that was eradicated globally. So if you want to get a rabies-free India by 2030, the mass vaccination program is the only thing that we can that reduces the transmission of the disease. What is mass vaccination? Suppose if we have a population of 100 dogs, if we do the vaccination to the at least of 70% of the population, that is 70 dogs, then there will be a herd immunity. Because if you do anything, we cannot do 100%. Even though if you do vaccination in a village or in an urban municipality, we cannot catch each and every dog. So at least if you do 70% of the vaccination, that means 70% of the population that is present in the area, we can achieve the herd immunity. So that herd immunity will eventually reduce the transmission of the disease, and it is the main key to reduce the transmission. So always we do the post, as I already told, the post exposure prophylactic doses. That means the post bite vaccination and category 1, 2, 3. You already know. So, so I would like to share some of the incidents. Why this transmission occurs? Otherwise, why these cases are rapidly increasing? It is because of negligence only. If you agree or not, I will share two incidences. One soldier, he rescued one puppy, 3-month-old puppy that was accidentally fell into the drainage. During the rescue operation, the dog bit the puppy was he was bitten by the puppy, and he neglected. After 3 months, he died with the rabies only. And in the Bimili also, this is very recent, in the 2023, I think, he has a small scratch on his leg by his own pet dog, and he didn't take the shot, and the dog was unprotected. He ignored. After 2 months, first the dog died. After 2 days, the owner also died. So if you take the two cases, there is lot of availability when compared to the old days. That means before 2000, there may be shortage of vaccination supply, but every institution, even we have the lot of supply of rabies vaccine for the animals, and every PHC, every CHC, and every hospital that is equipped with the rabies vaccine. Still, people are not taking the vaccination shot because they are taking the disease not much serious. So we have to educate the people about the importance of the post-exposure prophylaxis. That means they have to invariably take the vaccine shot so that the transmission will be reduced. And if you see, so many people are confusing. If you read the paper, there are two more incidences. In Greater Noida, near Delhi, there is a case that one woman died after drinking milk from the rabid cow. So how far it is true, I don't know, because the virus should get entry into the nerve ending. That means it won't get. That means human cannot be get infected after drinking the milk, because our engines are very strong. They will kill the virus, and we consume the milk after boiling only. Even though if we drink the milk as a raw, there is no chance of getting the virus, because it will enter into the stomach. Happily, it may be digested or it may be eliminated through the excretory system. That's it. How can it gain entry into the nervous system? That is not the case. That is actually, there is no case reported from the cows. The rabies case was not reported. Even a single case still now, that is not reported from the cows. And the news, that is 10 days ago, in UP, Gorakhpur, during a ritual, they distributed Panchamrita. You know Panchamrit. In the Panchamrit, they won't use boiled milk. They will use the raw milk as it is. So they distributed the Panchamrit to all the participants, and after 3 days, the milk from which the cow they have taken, that was died. And that gave panicness among the community. And after that, they have taken the prophylactic dose. But what I would like to say is, even though the cow gets the rabies virus, there is a possibility of getting infection through the cows is almost zero. There is because we call the animal. Even I accidentally put my hand into the one cow, because one case came to me, and that is there is a profuse salivation that animals is not taking. So I'm very young on that day. So that is about 15 years back. So with the enthusiasm, I opened the mouth and put my hand inside. After 2 or 3 days, the animal died. So I went to the hospital. That was at that time I was in Kakinada. So I went to the hospital and took my prophylactic vaccination. But through the cows, getting a virus, that means the getting a rabies disease, is nearly impossible. So in order to reduce the transmission or reduce the disease, we must collaborate. That means whenever there is outbreak, or whenever there is a case, or whenever there is a cases are reported either in animals, if there is a cases are reported in the animals, we have to note it, and we have to tell the same thing to the public health department. And if there is any cases, if there are any cases in the humans, they must tell us, so that we can collaboratively have a survey, and we can have the approach to eliminate the disease. That is, the collaboration is the key point, because it is not a that much deadly disease if we have stringent rules and prompt action that will certainly give our target. That means rabies free India by 2030. Next one is brucella. Anyone know about the brucella diseases? It is also a deadly zoonotic disease, but when compared to the animals, in humans it is very rare, maybe neglected, because the symptoms are very mild in case of human beings. It is a bacterial disease. It is caused by the brucella abortus in case of cattle and buffalo, brucella meltensis in sheep and goat, brucella suis in pig, and brucella ovis in sheep. Why? Because I'm mentioning is this: the brucella meltensis is the main culprit that is causing human brucellosis. The main important character in the brucellosis disease is it will cause abortions, especially mid-trimester abortions. That means in the mid gestation, that is 3 to 6 months of gestation, the animal will abort. So what happens if the animal aborts? There will be decline in the production, and the worst thing is they will become carriers. Once the animal affected with the brucellosis means it will be a permanent carrier. So what we have to do? We have to invariably cull the animal. That is a huge loss to the any farm or any farmer, because if he neglected that, if that abortion happened and it contaminated all the head, if we screen the head, out of the 10 animals, if the 8 animals are suspected, the 8 animals confirmed with brucellosis means he left with 2 cows. What he can do? So, and it has a genetic importance also. Who are the most affected person are the veterinarian, because those who are handling with the placenta, manual removal of placenta, they will get the contaminations. And the butchers who are working in the slaughterhouses, they are also at the risk zone. And the workers who are working in the dairy farms, they are also at great risk. When coming to the symptoms, I already told there will be abortion in case of females. In males, there will be a scrotal swelling, that is orchitis, and there is joint swelling and severe aches and body malaise. All these symptoms can be seen in the male ones. The same symptoms appear in the humans also. That is the main typical symptom is undulating fever. Undulating fever means the fever appears in the morning and subsides in the evening, and there will be a joint pain, hygromas, But if you see, the abortion risk in females is very less, because there is a component called erythritol. That erythritol is mainly present in the placenta of the animals. So the bacteria will colonize in the placenta, and that will cause the placentitis, and the abortion will eventually occur. But in humans, the erythritol level is very low, so there is a chance of abortions are very less. So quickly come to that. It is very endemic. It will be constantly present across the species. So it is also a public health hazard. So what we have to do? Regular screening is must. The screening was conducted 12 years, 15 years back in our department. To the surprise, there is a positive percent of 20%. So they are silent carriers. They are getting the symptoms, but even though they don't know, they have the brucellosis. So there should be a screening at all levels. In the animals, we are doing the milk ring test. So we take the milk and we mix with the brucella antigen. So if there is agglutination happens, that is a positive. And we also do the head screen test. And the best thing is, prevention is always better than cure. So we are doing the vaccination. The best thing is, it gives the lifetime immunity. If you give a vaccine dose to the animal, that vaccine protects for lifetime. That means the immunity is lifetime. So this is the brucella vaccine. And farmer training also a must. Those who are working in the farms, they have to be educated while removing the placenta, so that the contamination will be less. And the next is anthrax. It's already 210. So it is also an important disease. It will be caused by the bacteria Brucellosis anthracis. You might have heard the anthrax, because there are so many cases that were reported in the Padera also. It is also a highly fatal zoonotic disease. Why it is a public health concern means, whenever the vegetative forms, that means the brucella organism, when come into the contact with the air, or whenever there is a not suitable environment, the spores will, the vegetative forms will convert into the spores. And there are the what we call as anthracospores. These anthracospores are very dormant and very resistant. They will be in the contaminated soil or environment for decades. Literally 10 to 30 years they can survive. But whenever there is a favorable condition occurs, they will cross contaminate. They will contaminate through the animals. From the animals, after butchering or direct contact, we can get the disease. Or directly, if you consume the plant products which are contaminated with the spores, we can get the infection. So this is the method of transmission. Actually, in human beings, the transmission occurs in 3 ways. One is the direct contact. If a person who handles the affected animals, he will directly contact with the animal, so that he will get the infection. Or by the vectors also, that means mainly mosquitoes, they will also transmit the disease. And the third one is inhalation form. The bacterial spores which are present in the soil, they can be enter into the human system by direct inhalation. And this is the inhalation route is a very much severe form when compared to the other disease. In the cutaneous form, if you see, there will be a painless ulcer, and which is surrounded by the edematous part. So which is the classical sign. So how it transmits? When there is a anthrax affected animals, it won't show any signs. Most of the cases, it is a paracute form. Without showing any symptoms, the cow will die. Or so I would like to share one incident. In Paderu, nearly 16 cases reported of some skin lesions. They went to the KGH hospital. After taking the detailed history, they said that they have handled one dead sheep, that goat, which was affected with the anthrax. So they got direct contact, and Esther was developed. Soon after that, they informed to us, and we did the vaccination. That is a ring vaccination. So the worst thing is, whenever the animal dies, they open the carcass. When they open the carcass, the vegetative organs which are present in that will literally contaminate the place in its surroundings, and they will last for decades. So whenever the animal is dying due to the anthrax, the classical sign is there will be a tarry blood colored, that tarry colored blood that oozes from all the orifices. That is the classical sign. So whenever we get a case with bloody diarrhea, or there is an unclotted tarry colored blood coming from the orifices, means we should suspect for the anthrax, and we should not cut open the carcass, because we further contaminate the surroundings. So that is the case. So it also needs a multi-level collaboration, because if there is any dead animals present in the forest, or in the environment, or in the tribal areas, the forest department should mitigate the plan, and they have to inform us. So for the anthrax also, we have vaccination. That is a stern vaccination. But it is not a mass vaccination program. So we do ring vaccination. So if there is any case reported, that means we vaccinate the surrounding environment. That means 8 kilometers radius from the incidents happening. That is called a ring vaccination. So it is also endemic disease. When I am studying in Tirupati, the Chittur is very endemic. The cases are occasionally reported, but now people are much aware. Still, the another form is that inhalation form, what we call the wool sorters disease, because the spores that are present in the hides of the animals in the leather industry, while processing these leather, while making other leather products, these what are the spores, they will be accidentally inhaled by the persons, those who are working in the leather industry, and it was also cause the wool sorters diseases. So next, coming to the antimicrobial resistance, it's already time. Poultry, sir. Actually, coming to the poultry, the biggest threat, there are no zoonotic diseases from the poultry, because poultry have you ever seen that temperature of the poultry? Do you know what is that poultry temperature? It's around 107 degrees centigrade. That is a heat-blooded birds. So there is, and the lifespan of birds also very less, nothing. And uh, the bird, around 6 to 7 weeks. Now, what we call chicken 65. But now the time is reduced. We are cutting the poultry by 30 days only now. So the chance of getting a zoonotic disease from the normal desi birds is very less, but there is a cross contamination occurs when there is a wild birds. When the wild birds enter into the habitat of other birds, there will be a chance of getting the infection. Sir, sir, that is a misconception, sir, because for a bird that costs around 100 to 150 rupees, using a hormone is a big task for him. No, sir. Okay, sir. Because that there is a genetic evolution. That means we are selecting the birds which gain faster. That means previously the desi bird that will grow by 6 months. When compared to the broiler birds, what they are doing, they are keeping in case. The only duty of the bird is to eat. That's it. So genetically better FCS, that means feed conversion ratio is there. If you give 1 kg of feed to the bird, it will literally produce 1 kg of meat. That is happening. That is also happening. Even so, some of the growth promoters are being used, but that is also banned from the 2019. Government banned to use of growth promoters. So nobody are using hormones. There, yeah, that is a misconception as I see. But there is a genetic selection. That means we have developed such a breeds that will gain weight by 30 days. Now the broiler chicken what you are eating is a 30-day bird. They are not waiting up to 65 also. Previously they used to say that chicken 65, but chicken 65 became chicken 35 because within a month the time is money. For that they are reducing the cut down of the life cycle of the bird. So they are using growth promoters. And if you see from the day 1 to day 35, literally every day they use the some medication, either growth promoters, either levotonics or antibiotics or something. So that leads to antimicrobial resistance. That is the biggest concern when it comes to the poultry. As I told, we are uh, we are using abrupt use of that is antibiotics in the poultry because if the poultry means that is a integrated approach. That means poultry, if you see the poultry, the birds are very tightly packed, so there is chance of infection is very high when compared to the other animals, because other animals are loosely packed. They will have some density, but when come to the poultry, they are very densely packed. If you see the poultry, if you have anyone have visited the poultry farm, almost every bird will come into the contact with the other bird. There is a close proximity. So the chance of getting disease is very much high when compared to the animals. So what they are using from the day old chick, from the day old they are using vaccination. The vaccination regimen is carrying out at the same time from the 30 up to 30 days. The to table meat, they are using vaccine. That means antibiotics indiscriminately that we can't avoid, so that the antimicrobial resistance has been developed. So these are some of the pathways. Sir already told from the farm that a resistant pathogen will come to the food and it will eventually enter into the humans. This is the classical pathway. The resistant pathogens which are which the animals are harboring, they directly transfer to the human beings, or they will shed the resistant pathogens to the nature, and the nature is contaminated. From the nature, again, we are getting directly. So, what is the veterinarian's role in AMR? Another one is last one I have to mention. Mastitis. Mastitis is a chronic cases. That means it is not a disease; it is a condition. Mastitis means there will be an inflammation of udder. Whenever the inflammation occurs, the milk production ceases. These mastitis is of two types, either pathological or physiological. In physiological means there is no organ, that means that there is no pathogen present. There is no need to give the antibiotics. Just because of some stress levels or some allergic conditions or some other inflammatory mediators, because of that, they only develop the mastitis. In such case, if we give the antihistamines or anti-NSAIDs, that will cure the disease. But in rural practice, the quacks, what they are doing, out of their enthusiasm or they want to get the money, they are using the antibiotics. That is the main culprit. That even though there is a withdrawal period for every drug, it will be around 2 weeks to 4 weeks. But on the second day, if the disease was reduced, if the milk production gained, they will use the same milk. But up to 14 days, that milk will contain that antibiotic residues. And he will pour the milk into the some milk collection center, and it will be pulled up, and it will come directly into the house. So it is a $1 million question. The quality of the milk which we are consuming, whether it is good or bad, only God knows. So in order to get that, in order to be a good citizen, what we have to do is we have to promote reduction in the use of antibiotics, or we have to stop that. NDDB, National Dairy Development Board, suggested that alternative medical approaches, that means we are using homeopathic drugs and Ayurvedic practices, which are showing a good result. And the second one is developing a breed that is pathogen resistant, that means disease resistant. Previously, we have the ND animals, that means non-descriptive animals, desi animals. They are very drought resistant and pathogen resistant. They literally survive from the diseases, and the disease occurrence also very low. So if there is a low disease profile, means we don't use the any medication. So now we are concentrating more on the production of these desi breeds, that means desi animals, so that eventually the uses of antibiotics will be reduced, so that we will get the. And the last one is the environmental drivers. Due to deforestation also, there will be a wildlife and animal conflict that occurs. That also leads to the transmission of diseases. The best example for this is Kaisnur forest disease and the Nipah. What happened due to the deforestation? The fruit bats, they come into contact with the pig farms near the mango orchards, and eventually we also get the disease in the Kerala. The case were reported. And due to climatic change, due to the climatic change, as Salar told, if there is any rise in the temperature, the vector population will be increased. Due to the vector population increase, there is more transmission of the disease. And the pollution means any type of pollution. That the soil pollution will happen with the anthrax spores, or water pollution happens with the rat urine caused to leptospirosis, and air pollution, you can't say. And the intensive farming, as I said already, in the intensive farming also we use the antibiotics abruptly, that also leads to the disease transmission. And wildlife trees, poaching and wildlife thing, this is the main culprit, because of there is a excessive mutation that are happening while handling with the wildlife product, because the wildlife also having some of microorganisms, when it is contact with the human beings, that is a new host, so they will mutate very rapidly, that will cause the disease. So that it will give some of the pandemics. And water mismanagement means the water which is polluted, that we are using to the agriculture sector, so that the animals, the plants, they are getting the infection, that resistant pathogens, they are also. And biodiversity loss means trophic level. If we destroy the one trophic level, means there will be chance of incidences. And coming to the conclusion, if you all agree or not, human is the major culprit. If you agree or not, that is the major culprit. We are the culprits. We won't accept the what comes naturally, because we always need newer things. That because of that only there is a imbalance in the nature. So we are the culprits, and we are the ultimate sufferers. No doubt at all. All must agree that. So, in order to get a better health, we must respect the nature, and we should act responsibly, and we should not use abrupt uses of antibiotics, and we have to use any antibiotic judiciously, and we should follow strict and stringent food safety rules or food standards. And the last thing is collaboration, and collaboration is must, because only one sector, if it is working properly, and the other sector is not synergeting to other sector, that means it's a lack of it's a waste of energy, because the collaboration will gives a better results when compared to the single sector. So one nation, And One Health is not just a concept; it is a shared responsibility. As a healthcare providers, we stand before the human health. We, the veterinarians, will also stand beside you in order to get a better society. Thank you. Thank you, Ananda.
Thank you so much, sir, for highlighting on human and animal interface. We look forward to you, sir, for further communications in dealing with zoonotic transmission. Thank you so much, sir.
I'm
So,
pretty much delighted because it is my first job on duty
okay, sir.
and hope it will continue.
Yes, sir, definitely. Thank you,
Thank you,
sir.
Ananda.
So just take one more minute. Sir? Yes, sir. Please spare for 1 minute. We have to felicitate them for giving their valuable time and expertise. We'll be finishing very soon. Okay. So I would like to call Dr. Subbarao sir, Dr. Bose sir, Dr. Ramarao sir to felicitate both the guest speakers, and Dr. Sailahari ma'am. Please join, ma'am. Please join, ma'am.
Okay, so we are running very late. So we'll break out for lunch. Okay, lunch has been waiting for last 1 hour. Okay, for us. So we'll break for lunch, half an hour, 3 o'clock. We will gather back here. Okay, thank you.
You are not so lucky. Why? Postprandial session. Okay, so let's talk. Okay, I'm not going to give you a speech. Let's talk. Okay, it's very important for us to speak out, so that's what is important. Okay, so have the cool ice cream so that you are not going to sleep off also. A nice trick by boss sir also. Okay, fine. Now, so what we are talking about is antimicrobial resistance. Okay, so we had this world antimicrobial resistance week. So a very apt topic sir has selected. So what is about this One Health approach? Fortunately, when I visited this government medical college Srikakulam, so they too wanted me to speak. I chose this topic. So see, antimicrobial resistance cannot be considered as a problem that is prevalent in humans only. It's a problem in toto that we need to address. Okay, so please just going through this slide. Okay, what is happening here is the bacteria, the antibiotics are entering the bacteria. So what happens, the number of gates that are present on its cell wall are getting closed. So that is a mechanism of resistance. So even if it is able to pass through those gates, what happens is sometimes the antibiotics may be destroyed by the bacteria with the help of an enzyme. So even if the antibiotic is able to pass through that obstacle also, what will happen is the target will be masked, or the target will be changed, or a new target will be created which will be able to bypass the resistance mechanism. And last but not the least, bacteria have become so smart. They have become, even if the antibiotics is able to enter, it is able to remove with the help of an efflux mechanisms. So many of the broad spectrum antibiotics which you think are panacea of cure of any infection that is present in the body, they have a concomitant in efflux mechanism of resistance, which leads to the failure of efficacy of many of the antibiotics. Okay, now, so just see, we have our own thoughts. So I want to start my lecture also with the help of a metaphor. Metaphor means what I think about it or what you think about it. Okay, it's an issue that we are all facing. It's a global issue. After the COVID-19 pandemic, this is one of the issue that is plaguing us. You are all fearing COVID-19. You feared COVID-19. In fact, because of COVID-19, when it was there, antimicrobial resistance was less. You all became relaxed. Now AMR is such a silent pandemic. We are clueless about how to control it. Okay, so what I feel about it is, it is a tug of war with a monster that is we are having, and we are having a war. Okay, I will just describe this problem in the military terms. Okay, so we are being attacked by the bacteria. So we are having our own weapons, and that weapon that we are using is a chemical weapon. And what is that chemical weapon that we are using is an antibiotic. Okay, these antibiotic, broad spectrum antibiotics, are as akin to nuclear bombs. Okay, nuclear bombs are very destructive. Okay, so there are powerful antibiotics which are big guns. There are narrow spectrum antibiotics which are silver bullets. That is what is required. But we all go for broad spectrum antibiotics which are acting as nuclear bombs. Okay, so what happens is, if you see this problem through a lens of a battle and there is an enemy, what will be the end result? Either the enemy survives or you survive. Okay, means bacteria, if the bacteria are really winning, we will all be eradicated, isn't it? We'll all be eradicated. So the thing is, whenever you are taking whenever there is a war, okay, innocents die. Yes or no? Do you agree? Yes or no? So when you are taking an antibiotic, you have a beneficial flora that is present in your body. Those are getting, those are dying. Okay, that is the collateral damage that is happening. For example, many a times you would have personally experienced when you have taken an antibiotic, because of the, after taking that antibiotic, you have a diarrhea, and that is because of Clostridium. And that Clostridium is that Clostridium you yourself have induced because you have taken an antibiotic. Okay, so already that is happening. So there is a concept called dysbiosis. Okay, you have a microbiome, and microbiome dysbiosis. It is means it has been evidenced as root cause for many diseases, even many of the chronic diseases. But what is happening here is, we are already evidencing a dysbiosis, acute dysbiosis because of the antibiotic that you have taken. Okay, now, so I just want to know, I just want to impress upon you is that, is this a new problem that there is a focus? We are trying to approach it with new solutions or recent solutions. This is not a new problem. Okay, resistance genes are among us since ages. Okay, resistance genes are among us since ages, it's not new. Okay, so what we are trying to explain is, this is what is the sum and substance and the basis of One Health approach, this one slide. Okay, antimicrobial resistance genes are present in the environment, antimicrobial resistance genes are present in the humans, antimicrobial resistance genes are even present in the animals. Okay, so what happens is, these genes are usually immobile, they become mobile, and they become mobile genetic elements, or they become insertion sequences, or they become transposons. So what happens is, they are able to jump within the bacterium, or they are able to jump from one bacterium to another bacterium. And majority of the cases of antimicrobial resistance is because of the horizontal transfer, is the horizontal transfer of antimicrobial resistance genes. So this is an ecology that is present where resistance genes are getting transmitted. So I would divide this ecology, some the ecology within our body and the ecology in the sense that is our environment. Okay, we will talk about ecology within the body and ecology, just have a different approach, ecology within our body and ecology in the environment. So these antimicrobial resistance genes get transmitted in the environment itself, and then they may be reaching us. Or what may happen is, they may be present within the human beings. Okay, or they may be present in the animals, they may be transmitted from the animal to the human being, or from the human being to the animal. So this exchange can happen anywhere, it's not just happening within our human beings. So what happens is, if you are only focusing on the human side of the problem, majority of the problem you are excluding, majority of the problem you are not looking into, or you are not serving the purpose, or you are, if you are your efforts are directed towards a very minuscule of the problem. Okay, so it's very ancient, and answer is, if you visualize it, instead of looking it as a war between bacteria or the microorganisms and the human beings, if you think, see, whenever there is a war, we try to solve the war. Okay, what we do, we with with churchal jariptam kada, that is diplomacy, and we try to cooperate. So if we try to cooperate, and if you are trying to a diplomatic approach with the bacteria, I feel the only solution that means is available for us is the seeing this problem through a lens of microbiological evolution. Okay, and through microbiological ecology and microbiological evolution. So how you can tilt the tilt yourself away from the war is, you want, don't think it as killing the bacteria as the only solution. You should prevent the virulence within the bacterium, you should prevent the pathogenesis of the infection because of the bacterium within your own body. That is another ecology that is present. Okay, so with this thing, what I want to tell is, whenever, if the diplomacy and cooperation fails, what happens, everyone is very insecure, everyone is very insecure. So what happens is, there will be arms race between two competing, the whoever is the enemy, whoever is the favor, whatever it is, there will be always an arms race. So we are in an arms race. Why? Because we are using one antibiotic, we are looking for the next best broad spectrum antibiotic the very next day in order to kill the bacterium. So there is an arms race that is happening, and you have to stop this arms race. How it is going to happen? The solution lies in stewardship. Okay, the solution lies in stewardship. So with this in brief metaphor, I'm going to start the topic in real terms, that is One Health considerations on antimicrobial resistance. What we are trying to do is not just antimicrobial stewardship within the hospital, we have to consider antimicrobial stewardship across the populations. So why this ecological concept is very important? Because inappropriate use of antibiotics not only happens in humans, it is already happening in livestock, even it is happening in water. Okay, we have antibiotics in water and the sanitation systems, and we are having environmental pollution, which is further aggravating the transmission of antimicrobial resistance genes. Okay, I want to ask, how many of you like chicken? Raise your hands. Yeah, very good. So which part of the chicken, means biryani parcel చేసేటప్పుడు ఏ పీస్ ఏమంటాం? లెగ్ పీస్. ఏ లివరా? సరే, this is different. Okay, leg piece adugutam. Okay, how many of you know about the drug colistin? Any idea about colistin? What is that? No, it's an antibacterial last resort. Okay, for many of the multi drug resistant organisms. And you will be surprised, you will be having colistin resistance by chewing that cartilage of that chicken leg. You know that? Because these small chicks will be able to survive to become a big fat hen for you. 900 grams chicken is very good because it's very tender and soft. You can chew the leg very easily. Why is that happening? Because colistin is a growth promoter in the poultry industry, and most of the injections are given near the leg, okay, and which you are all chewing. So if you ever want to have colistin resistance, I'm not asking you to become a sattvic person, okay. I'm asking you to avoid eating leg pieces, okay. I too like eating leg, okay. But what to do, I have graduated to you having that breast piece, okay, which foreigners are already intelligent. What they do, they use the breast piece, everything, and whatever leg pieces are there, they will be exporting, okay. Even countries like us will receive that livestock, okay. Now, so one health can be tackled when once you are able to recognize that there is an interlink between the human health, the animal health, and the environmental health, because resistance can spread among all of these, okay, from the environment or within the animals, from the animals to the human beings, and from the humans to the environment also, okay. So you are having an antibiotic. So where is that antibiotic? Rest of the antibiotic going away. Okay. Through your stool only it is going to reach the environment. Antibiotic factories, they will be also in their effluents we are having antibiotics. So many of the pollutants which are cations and anions, they will enhance the ability of the bacteria to get antimicrobial resistance genes. So it's a holistic approach we need to have. So from since when One Health became fashionable, for that we need to know a little amount of the history. So we were talking about staphylococcus aureus. We got the penicillin, so we are able to win over staphylococcus aureus. That was during 1940s and 1960s. By the time 1960s and 80s, we came to know about the superbugs, because we have already been discovered about the plasmids. Okay, plasmids carry a lot of multi-drug resistant genes. Means a cocktail, they are having మనమెళ్ళే తాగే కాక్టైల్స్ కంటే ఈ కాక్టైల్స్ ఇంకా స్ట్రాంగ్, ఓకే. మల్టీ డ్రగ్ రెసిస్టెంట్ జీన్స్ అంటే ఒక ప్లాస్మిడ్ విల్ బి క్యారింగ్ antibiotic resistance to multiple drugs, multiple classes of drugs. Then there was gradual superbugs వచ్చాయని దాని గురించి అవేర్నెస్ పెరిగింది by 1980s and 1990s. Then we thought there will be end of antibiotics, okay. Further, this problem was compounded when we thought climate change is also a component in 2010 and 20. By the time COVID-19 came, we thought we cannot deal with it as a singular problem. We have to think it as a ecological problem, and we need to have a One Health approach, okay. So now, sir, why are you talking about so much of antimicrobial resistance? If you ask me not to give antibiotics to the patient, how is the patient going to survive? This is the question that many a microbiologist face from the very angry clinicians. Okay, so but isn't there any evidence that I'm asking them not to give unnecessary antibiotics? There is mortality because of antimicrobial resistance, and in fact, you will be the very basic E. coli that is already a part of your normal flora. In fact, it is you have all gone through NEET examinations. NEET examination lo question undi. How much part of your stool by weight is E. coli? It's 55% of your stool is by weight is E. coli. Okay, means understand how much amount of E. coli. If all of this E. coli becomes multi-drug resistant, what will be the condition of this human race? Okay, now again there is mortality because of methicillin resistant staphylococcus aureus. There is lot of publications regarding it also. So you can ask, sir, what will happen, sir? Today there will be new antibiotic in the market soon. Why are you stopping us from giving antibiotics? I'm telling you, the pipeline for antibiotics is very limited now. Okay, and if at all antibiotics come also, they will be very costly. So even if antibiotics are there in the market, the problem of economy is there. So means, what is it economical to have those antibiotics, or are there any economical barriers that make the availability of these effective antibiotics to who are really need of it? Okay, for example, ceftazidime avibactam Okay, if it's not a, it's a very cheap drug. Forget about colistin also, meropenem, vancomycin and all. We have all graduated to ceftazidime, avibactam. మొన్న వరకు పిప్రాసిలిన్ టాజోబాక్టమ్ జెమ్స్ పాపిన్స్ మల్టీవైటమిన్స్ లాగా అందరికీ వేసేసుకొని ఇప్పుడు పిప్రాసిలిన్ టాజోబాక్టమ్ నేను కళ్ళు మూసుకొని రెసిస్టెన్స్ టెస్ట్ చేయకుండానే నేను రాయగలను. దట్ ఈస్ ద స్టేట్ ఆఫ్ అఫేర్స్. ఇప్పుడు సెఫ్టాజిమ్ ఎవిబాక్టమ్ కూడా అలాగే మళ్ళీ వాడుతున్నాం. సో దాన్ని ఇట్స్ నాట్ చీప్. ఇప్పటికి ఇన్సూరెన్స్ మన గవర్నమెంట్ ఇన్సూరెన్స్ స్కీమ్స్ వల్ల అందరికీ మనం ఎవరికి రియల్లీ రిక్వైర్డ్ వీఆర్ నాట్ ఏబుల్ టు ప్రొవైడ్ దెమ్ బికాస్ వీ హ్యావ్ limitations. So this is one of the live example that I am giving you. Okay, inka forget about below poverty line people. Okay, so what about the new antimicrobials? For example, malli idi India lo inka raale cefidoxil. Okay, ademoutundi, what is happening with that is there were studies that were taking place. A group of individuals who have not been given cefidoxil and who were given cefidoxil for they were they made a study and see for the change in mortality, 14-day mortality. There was no difference. Okay, 14-day mortality if the standard of care was very good. If the standard of care was very good, okay, the mortality was same as that in the group that got cefidoxil. Okay, so there is nothing like if even for standard of care also there is cost. Yes or no? Okay, so there is nothing like always that antimicrobial is the panacea of all cure. Okay, so now sir, why people are good and this is not my problem. Okay, you can say that this is not my problem, but the population is having a vulnerable population. Mana dantlo whole human population, the most vulnerable population is the very elderly, the women. Okay, and the low resource setting, whoever is in the low resource setting, they're all uh, uh, very vulnerable. So a madam comfortable కావాలి కొద్దిసేపు పోతే కూర్చుంటాను ఇక్కడ ఉన్నాను. So the most vulnerable is what is being affected with majority of the antimicrobial resistance. That is what is the irony. Okay, the vulnerable population which we feel already are vulnerable, they have an additional burden of antimicrobial resistance. Okay, now so is it real, sir? Are you making assumptions? Yes, I without any evidence I will not speak. So what is there is so this such kind, so why abroad studies, why not in India? None of these kind of studies have happened. Okay, so based on differences in the socio-economic indicators, the antimicrobial consumption varied. So because there is socio-economic indicators are different and consumption is different, you cannot use the same formula to reduce the consumption of antibiotics everywhere. Am I clear? So there should be modification in the approach to this problem, and it should be according to the local conditions. That is what the study says about. Okay, you cannot make a fix it all situation for everyone. You have to look. Even you come from your own hospitals backgrounds, so your hospital will be having its own ecology and it will be having your own problems. A population that is being served by it will be also having a different socio-economic indicators. So you have to tamper your program for prevention of excessive usage of antibiotics accordingly. Okay, now so is there really an association between the older individuals and antimicrobial resistance? So what happened during COVID-19? COVID-19 Avagana, so we thought that elderly population are very susceptible to COVID-19. So whatever antibiotic little evidence we had, Trump kuda India ki warning ichcharu, doxycycline nu India in America ki pumpinchipote, we will sanction you and see. So that was the kind of a scary situation where antibiotics, because India was a very good production center for doxycycline, we came under a lot of pressure in order to export, even because we had a lot of elderly population also. Okay, మేమందరూ కూడా మనందరూ కూడా తీసుకున్నాం. Yes or no? Okay, ఎందుకంటే we all treated those patients. Okay, so what happened is, so downstream antibiotic resistance is a term ఎందుకంటే once you have taken antibiotics, after consumption of antibiotics resistance to now. So downstream antibiotic resistance increased because of pre-COVID exposure of lots of amounts or cocktails of antibiotics. That is what this study says about. Okay, so మీరు చెప్పొచ్చు సార్ ఇదంతా జస్ట్ స్టోరీలు కహానీలు సార్, ట్రస్ట్ ఇది ఆల్ ఆర్ వెస్టెడ్ ఇంట్రెస్ట్, ఆర్ దీస్ వితౌట్ ఎనీ ఎవిడెన్స్ అంటే దిస్ ఈస్ ద ఎవిడెన్స్ ప్రీ-కోవిడ్ యూస్. సో కంట్రోల్ గ్రూప్ ఏది అంటే నార్మల్ ఇండివిజువల్స్ లోనే మనం యాంటీబయాటిక్స్ ఇచ్చి post downstream antibiotic resistant organisms ni we have seen the evidence. Okay, now so what why there is a limitation with the availability of new antibiotics sir? Enduk sir mana Indian our human ingenuity is endless, so we can always come up with new antibiotics ankochu kada. So but what happens is the money for R&D is mostly for క్యాన్సర్ థెరపీ అంటే క్యాన్సర్ వచ్చిందంటే ఫ్యామిలీలు బతికించుకోవడానికి ఎంతనే మేము ఖర్చు పెట్టుకుంటాం అని అనుకుంటారు. కానీ ఇన్ఫెక్షన్ వస్తే అక్యూట్ కండిషన్ 4-5 రోజుల్లో పోతారని తెలిసిన తర్వాత ఎందుకు అంత ఖర్చు పెట్టాలి అని అంటారు. సో ఆ ఎకనామిక్ లాజిక్లో ఏమవుతుందంటే R&D స్పెండింగ్ ఈజ్ మోర్ ఫార్ immunotherapies and other anti-cancer therapies. Gani, when billions of dollars are being spent on saving a patient with cancer, that cancer patient will be having multiple visits to the hospital, and he will be getting, in spite of getting a very good anti-cancer therapy, he will be dying because of contracting an antimicrobial resistant organism in one visit of the hospital. So lakhs and crores of rupees that you have spent is all gone into the drain. Okay, so immunocompromised eye is one of the focus area for antimicrobial resistance. Everything is economics, my dears. So we are in a very grave situation. ఎలాగా పాతకాలపు సినిమాల్లోన ఫేర్స్ అని అయ్యేటప్పుడు ఏంటి రోప్ మీద చిన్న పిల్లల్ని బ్యాలెన్స్ చేసేవారు, మన పరిస్థితి కూడా అంతే. Okay, we have to maintain a balance between prevention of the infection, treatment of the infection, and emerging resistance. So our situation is very delicate. So what you need to do now, so we have to think about the past history తీసుకుంటారు మీరు clinical infections లో. So antibiotic ఇస్తే ఏమవుతుంది, what will happen in the future, that is the consequence we have to think about. So past గురించి ఏంటంటే we have to think about whether he has the patient is having cancer, okay, whether he is taking any kind of immunosuppressants, whether he has taken any kind of transplant, he is having any devices which will lead to colonization, okay, and he is having any kind of past infection. So what will be the consequence if you give antibiotics? There will be mortality, or if you don't give antibiotics, okay, there will be mortality, there may be graft rejection, there may be clostridium difficile infection, there will be adverse events due to because of antimicrobials, there will be PKPD problems, there will be hospital acquired infections, so drug interactions, antimicrobials and anti-cancer therapy and immunosuppressants getting interacting. So ఎన్ని రకాలు మనం గుర్తుపెట్టుకోవాలి whenever you are talking about giving an antibiotic, not just about resistance alone. Okay, so what is we are talking about is stewardship. Stewardship means a guided programmatic approach and a coordinated strategy to sustain the effectiveness of antimicrobials by reducing their consumption and improving the patient outcomes, and also promoting the safe usage of antimicrobials at any level or any system. Okay, so what are the guiding principles of antimicrobial stewardship? Timely management with antimicrobial therapy, appropriate antimicrobials, appropriate administration of the antimicrobials is also a very costly antibiotic. తెచ్చేస్తాం, ఎంత డోస్ ఇవ్వాలి తెలీదు, ఎలా ఇవ్వాలి కూడా తెలీదు. Okay, that is a big problem. So మైక్రోబయాలజీ ల్యాబొరేటరీని బాగా వాడుకోరు. ఓకే, యాంటీబయాటిక్స్ రిపోర్ట్ వచ్చినా కూడా అది అవుతుంది, బాగానే ఉన్నాడు కదా, సో హై అండ్ యాంటీబయాటిక్స్ వెళ్ళని. సో there should be de-escalation, there should be a change of antibiotics in order to give from a broad spectrum antibiotic which is given as an empirical therapy, you have to narrow down it to a narrow spectrum antibiotic. Okay, now using of point of care resources, and you have to need to have a mechanism of transparent usage data regarding the antimicrobials, so that you will be having an appropriate stewardship infrastructure within your system. Now, so core interventions. Okay, so what happened was, how can you go about doing it? Okay, so you can have an audit, you can provide even a feedback. Okay, so within the audit, what you are going to check for, are there appropriate doses going, whether they are going through appropriate IV or oral therapy, or once we have known that there is no more requirement for IV, we can go for oral, because IV health resistance ఇంకా ఈజీగా డెవలప్ అవుతుంది అన్నమాట. So if you want to preserve some of the antibiotics being recklessly used within your system, you can go for a restriction method. like within your institution, like you need to take an approval before you use that antibiotics. So there should be a, your boss only can use it, approve it, not you can use it. Okay, if the boss allows, boss is always correct. If boss allows, you have to use the antibiotics. If boss doesn't allow, you should not use the antibiotics. That is the core thing. So local, you need to have your local guideline. Boss will also be guided by local guidelines. Okay, he will not also act arbitrarily. You all think boss today said not to use, tomorrow he is saying to use it. He is also bound by guidelines, my dears. Don't think boss is always arbitrary. Okay, now there should be education and awareness why the boss is acting that way. You should also be aware of it, and that you can only be knowing when you are educated yourself. So, and monitoring and reporting the antimicrobial use, and there should be benchmarks. If you establish a benchmark, today you have given 10 doses, tomorrow for this group of patients you need to reduce it by 50%. Okay, and you have to improve the standard of care. That is what is your aim. Okay, now antimicrobial strategies are not always the same for every healthcare setup. Okay, for acute care hospitals it will be differing from long term care centers. So the importance, I want this, though the slide is self explanatory, with acute care hospitals and long term care facilities. In long term care facilities, what happens, there is lot of devices, for example a urinary catheter, and if you collect a urine sample, he will be already, the device will be colonized. So whether the microbiology department is reporting about the colonizer or whether it is reporting about the pathogen, how will you be able to know? We will also be not be able to know, because you don't give us history. We give you trash in, trash out. So whatever goes into the microbiology department, accordingly the report comes out. It's the same for pathology and biochemistry also. So what happens here is, not only stewardship with respect to usage of antimicrobial, diagnostic stewardship is also very, very important, because in places where there is normal flora, if there is not a good collection of the specimen, normal flora will contaminate the specimen. That one will lead to the not the pathogen being growing, the colonizers being grown. So you will be treating the colonizer and not the pathogen. So what will happen? Previously అందరూ క్యానులాలు క్యాథెటర్లు కూడా పంపించేవారు. క్యానులా మీద ఆర్గానిజం, క్యాథెటర్ మీద ఆర్గానిజం గ్రో అయ్యి మేము రిపోర్ట్ ఇస్తాం. సో మీరు ఏంటి ట్రీట్మెంట్ చేస్తున్నారు? పేషెంట్కి ట్రీట్ చేస్తున్నారు, లేకపోతే క్యానులాని క్యాథెటర్ని ట్రీట్ చేస్తున్నారు? So there is a sea change in your approach to treatment. Okay, so diagnostic stewardship precedes antimicrobial stewardship. Okay, now సో సో ఎన్ని రకాలు చేయమంటున్నారు సార్, ఇదేం బాధ మాకు అని మీరు అడగొచ్చు నాకు. సో దానికి కూడా నేను ఎవిడెన్స్ ఇవ్వాలి కాబట్టి ఇది దిస్ ఇస్ వన్ ఆఫ్ ద వెరీ ఇంపార్టెంట్ స్లైడ్. సో ఈజ్ యాంటీమైక్రోబియల్ స్టూవర్డ్షిప్ ప్రోగ్రామ్స్ ఇంపార్టెంట్? So antimicrobial stewardship programs have led to a reduction in antibiotic prescription. They have led to reduction in antibiotic consumption, and there is this kind of response is more pronounced in high income countries. Malli. So what happens is, hospital ki వెళ్ళి అక్కడ ఖర్చు పెట్టే బదులు ఫార్మసీకి వెళ్ళి ఒక యాంటీబయాటిక్ డోస్ తీసుకొని తగ్గించేసుకుంటే సరిపోతుంది కదా అని లో అండ్ మిడిల్ ఇన్కమ్ కంట్రీస్లో ఒక థాట్. సో అందుకోసమే లో అండ్ మిడిల్ ఇన్కమ్ కంట్రీస్లో hospitals lo kanta education programs among the population is more important in order to prevent exposure. Emante meeku already vaadu oka pharmacy lo oka antibiotic teeskunnadante vaadu already resistant ayi mana hospital setting ki vachadante, there will be limitation in your treatment options, not anyone else. సో అప్పుడు ఏమవుతుంది, మనకి అప్రతిష్ట ఏంటి, వచ్చినా కూడా హాస్పిటల్కి తగ్గట్లేదు, ఆ ఫార్మాసిస్టే బెటర్ కదా అని ఒక kind of false belief వచ్చేస్తుంది. We are not responsible for that. It's the economic condition of the patient that led to such kind of decisions. Okay, now సో ఏఎంఆర్ని ఏదైనా సార్ ఒక్క థింగ్ చెప్పండి, ఏఎంఆర్ని మొత్తం అంటే చాలా వరకు ప్రాబ్లమ్ని అరికట్టగలదా అంటే నేను చెప్పలేను. So it should be concerted efforts, and there are multiple efforts should go hand in hand. Then only we can means take care of this very grave problem of antimicrobial resistance. So antibodies as an alternative to antibiotics. So very good and diagnostic stewardship. Host, we forget about always host immunity as a part. If host immunity perugutundante, naturally infections will be reduced. So that part we are already ignoring. So antibiotics e kaakunda vaccines, there is microbiome, and there is also phase therapy. That is also a lot of interest is there, and already clinical trials are happening. So why not prevent infection before it occurs and prevent the use of antibiotics. That is why whenever there is World Antimicrobial Awareness Week, before that, which happens in November, October, there is an infection prevention week. So infection prevention will lead to less opportunities for usage of antibiotics, isn't it? It's logical. If you are preventing infections, there will be no antimicrobial resistance. So infection prevention ante చేతులు కడుక్కోవడం ఒకటేనా? So infection prevention is also about vaccination. So antimicrobial resistance otti microbiologist problem e kaadu. Okay, now antimicrobial resistance is a community medicine problem also, isn't it? Vaccine coverage. So unvaccinated individuals, more the chances of incidence of infections. But once distinct population, herd immunity అంటాం కదా, in herd immunity రీచ్ అయ్యామంటే ఇన్ఫెక్షన్స్ కూడా తగ్గుతున్నాయి కదా. ఇన్ఫెక్షన్స్ తగ్గాయంటే అప్పుడు ఏమవుతుంది, యాంటీబయాటిక్స్ యూజెస్ ఆటోమేటిక్లీ తగ్గుతుంది. ఫర్ ఎగ్జాంపుల్, మీరు యాంటీ రెస్పిరేటరీ ఇన్ఫెక్షన్స్ కొంచెం ఇన్ఫ్లుయెన్జా వ్యాక్సిన్స్ తీసుకుంటారు, మోస్ట్ పాపులేషన్ తీసుకున్నారంటే అప్పుడు ఏమవుతుంది, యాంటీబయాటిక్ యూసేజ్ normally gets reduced. ఏమంటే most of the antibiotics are even prescribed because cold is usually a viral infection, but we think that cold antiviral viral infection can also be cured by antibiotics. Okay, మనమే ఎందుకు, మనకి డ్యూటీ రేపు పని ఉన్నది, మళ్ళీ నాకు సెకండరీ బ్యాక్టీరియల్ ఇన్ఫెక్షన్ అవుతుందని తెలుసుకొని రాకంటే మనం యాంటీబయాటిక్ వేసుకొని డ్యూటీకి వచ్చేస్తాం. ఆ ప్రాబ్లం మనలో కూడా ఉంది. ఓకే, now so vaccines and AMR, a decrease in drug resistance infections and associated treatment failures. There has been a reduction in antimicrobial usage and reduced healthcare and economic burden from hard to treat infections is possible when there is increased usage or increased coverage of vaccines. Okay, the value of vaccine to mitigate antimicrobial resistance, okay, from low and middle income countries is very, very high. ఓకే, కానీ ట్రంప్ వచ్చిన తర్వాత వ్యాక్సిన్స్ ఈస్ ఫేక్ అని చెప్తున్నారు. ఓకే, సో వీ వాంట్ టు రీవిజిట్ ద ప్రాబ్లమ్. సో వాట్ కెన్ బి ద సొల్యూషన్ విత్ ద హెల్ప్ ఆఫ్ వన్ హెల్త్? సో ఫస్ట్ ప్రాబ్లమ్ ఎంత ఉంది అని మనం చూసుకోవాలి. అదే ఎన్వైరన్మెంట్లో చూస్తాం, హోస్ట్లో చూస్తాం. హోస్ట్లో ఎంతవరకు యాంటీమైక్రోబియల్ రెసిస్టెంట్ ప్రాబ్లం ఉన్నదంటే అది ఎలా తెలుసుకోవాలంటే సర్వేస్, ఫెసిలిటీ లెవెల్ అసెస్మెంట్స్, శాంపిల్స్లోనే యాంటీమైక్రోబియల్ రెసిస్టెంట్ బ్యాక్టీరియా. అదే ఎన్వైరన్మెంట్లో ఎలాగా ఎంతవరకు ప్రాబ్లం ఉందని తెలుసుకోవాలంటే ecological level assessment, facility level assessment, food, water and sewage samples. So what you can, how can you detect? You can detect it with the help of phenotypically. You can know the bacteria, this antibiotic is not going to work. But why it is not going to work? You have to go for genotypic testing, especially whole genome sequencing, because resistance is now not limited to a single mechanism. It is really interlinked. Many multiple mechanisms are acting together. Okay, అందుకోసం combination drug therapy is in vogue. అదే సెఫ్టాజినియం అవైబాక్టమే ఒక ఇది. So vaccination and how can the impact, how can these measures be impacting the human health? So it may lead to colonization, clinical infection, hospitalization and mortality. So ఇవన్నీ ప్రివెంట్ చేయడానికి we want to assess the problem. And we are talking about microbiome. So if your microbiome is already having an antibiotic resistance bacteria, so it becomes a resistosome. So the resistosome is also a new term that is coming into fashion now. Okay, సో నా ప్రీవియస్లీ మేము చదువుకుంటున్నప్పుడు, అంటే మా అనంత నారాయణ టెక్స్ట్ బుక్, మీ అందరు కూడా అనంత నారాయణ చదువుకున్నారు. అండ్ టైఫాయిడ్ ఫీవర్ వచ్చిందంటే ఒక ఏరియాలోన, అప్పుడు ఏంటంటే గాజ్ పీసెస్ వెళ్ళి వాళ్ళ ఎఫ్లూయెంట్ ఎక్కడ వస్తుందో అక్కడ పెట్టేవారు. తర్వాత ఏ ఇంట్లోనే టైఫాయిడ్ క్యారియర్స్ ఉన్నారు, దానికి ఆ గాజ్ పీస్ తీసుకెళ్ళి మళ్ళీ సెలెక్టివ్ మీడియాలో పెడితే కాలనీస్ గ్రో అయ్యాయి అంటే ఆ ఇంట్లో వాళ్ళకి టెస్ట్ చేసేవారు, లేకపోతే లాక్కొని వెళ్ళేవారు, ఏదో ఒకటి చేసేవారు. సో అది మాత్రం ఇప్పుడు హ్యూమన్ రైట్స్ అన్ని అనగానే అది ఆగిపోయింది. ఓకే, సో దెర్ వర్ ఇష్యూస్ విత్ ఇట్. So now what is happening here is COVID-19 వచ్చిన తర్వాత వేస్ట్ వాటర్ ట్రీట్ ప్లాంట్స్ sewage లోన, అందులోన we were looking for COVID-19 వైరస్. ఓకే, సో అందులో COVID-19 వైరస్ ఉన్నదంటే దెర్ ఈస్ యాక్టివ్ ట్రాన్స్మిషన్ హ్యాపెనింగ్ విద్ ఇన్ ద, అంటే ఏ సిటీ ఆ ఏరియాకి క్యాటర్ చేస్తున్నా, ఒక సిటీకి క్యాటర్ చేస్తున్న, టౌన్కి క్యాటర్ చేస్తుందంటే ఆ ఏరియాలో యాక్టివ్ ట్రాన్స్మిషన్ అవుతుంది అని తెలిసింది. సో నా దిస్ from testing of patient samples, we have graduated to testing of environmental samples in order to gauge the infectious diseases problems, especially antimicrobial resistance. So now if a microbiology laboratory will say there will be a day when you cannot refuse samples from environment, you cannot refuse samples from animals. or veterinary sciences. So there will be there will be a day అంటే నేను ఇప్పుడు చదువుకోవాలి మళ్ళీ టెక్స్ట్ బుక్ తీసుకొని వెటర్నరీ ఆర్గానిజమ్స్ ఏంటేంటి మళ్ళీ ఎన్వైరన్మెంటల్ ఆర్గానిజమ్స్ ఏంటేంటి అని. సో నా ఫ్యూచర్ కలీగ్స్ విల్ బి వాళ్ళందరికీ మైక్రోబయాలజీ ఒక టెక్స్ట్ బుక్ ఉండదు, ఎన్వైరన్మెంటల్ మైక్రోబయాలజీ అని ఒక టెక్స్ట్ బుక్ ఉంటుంది, తర్వాత వెటర్నరీ మైక్రోబయాలజీ అని కూడా ఒక టెక్స్ట్ బుక్ ఉంటుంది. ఓకే సార్, తర్వాత మీకు కూడా కొన్ని అడిషనల్ ఉంటాయి. ఓకే, మేము ఎస్కేప్ అవ్వలేమంటే మీరు ఎస్కేప్ అవ్వలేదు. ఓకేనా? సో వార్ అయింది, కొలాటరల్ డ్యామేజ్ అవుతుంది, వార్ ఆగాలి అంటే వాట్ వీ షుడ్ డూ, ఆర్మ్స్ రేస్ ఆగాలి. ఓకే, ఇవి ఏమైంది, వరల్డ్ వార్ అయిన తర్వాత రష్యా అండ్ అమెరికా విపరీతంగా మిసైల్స్ న్యూక్లియర్ బాంబ్స్ ప్రొడ్యూస్ చేశారు. కానీ ఒక లెవెల్ ఆఫ్ మ్యాడ్నెస్ తర్వాత ఏంటి, వాట్ దే థాట్ అబౌట్ ఇట్ ఈస్ నాట్ సస్టైనబుల్. సో నువ్వు ప్రొడ్యూస్ చేయక నేను ప్రొడ్యూస్ చేయను అటామిక్ బాంబ్స్ కానీ మిసైల్స్ అని దే లిమిటెడ్, విచ్ వాస్ కాల్డ్ యాజ్ అ సాల్ట్ ట్రీటీ, SALT I think so. Okay, so that is what is called as disarmament. So the problem is not resistance, the problem is pathogenesis. Problem is pathogenesis and virulence of the organism. So if instead of giving antibiotics to kill, you should provide such biological products which will be which will not able the microorganism to gain virulence to cause infection. E. coli should not become virulent enough what is present in your normal flora to cause infection in you. So therapy should be going that way instead of going on developing next generation of antibiotics. So antivirulent strategies, sorry ఇదేంటి సైన్స్ ఫిక్షన్ అని అడగొచ్చు. యాంటీవిరులెన్స్ స్ట్రాటజీస్ మనం ఆల్రెడీ వాడుతున్నాం. ఓకే, మీరు కూడా వాడుతున్నారు. యాంటీబాడీస్ కొన్నిసార్లు ఇస్తాం. ఓకే, యాంటీటాక్సిన్స్ మనం ఇస్తున్నాం. ప్లాస్మిడ్ ఇవి ఆల్రెడీ మనం వాడుతున్నాం. ద లేటెస్ట్ టెక్నిక్స్ ఆర్ ప్లాస్మిడ్ ఇంటర్ఫరెన్స్ అండ్ ప్లాస్మిడ్ క్యూరింగ్. ఓకే, అందరూ వాడతారు కదా, పెర్ప్లెక్సిటీ, తర్వాత చాట్ జీపీటీ, ఇవన్నీ. అందులో ఒకసారి ప్లాస్మిడ్ క్యూరింగ్ అంటే ఏంటి, ప్లాస్మిడ్ ఇంటర్ఫరెన్స్ అంటే ఏంటి, ఎక్కువ టైం అయిపోతుంది, అందుకోసం నేను చెప్పట్లేదు. ఓకే, నా సో వాట్ హ్యాపెన్స్ ఈస్ కొన్నిసార్లు ఆల్వేస్ టఫ్, being tough is not always the thing. Influencing is also important, and influencing can be done with the help of soft power. Soft power అంటే ఏంటి, మన కల్చర్, ఓకే, తర్వాత మన ఫుడ్ ప్రాక్టీసెస్, ఇలాంటివన్నీ అనమాట. ఇండియా ఈజ్ హ్యావింగ్ అ లాట్ ఆఫ్ సాఫ్ట్ పవర్ బికాస్ ఆఫ్ విచ్ ఇట్ ఈస్ వీఆర్ కల్చరలీ రిచ్, వీ హ్యావ్ డైవర్స్ ప్రాక్టీసెస్, we have diverse population, because of which we are very rich with the help with respect to soft power, and we are respect even మన దగ్గర ఎక్కువ మిసైల్స్ న్యూక్లియర్ బాంబ్స్ లేకపోయినా ఇండియన్స్ హ్యావ్ సమ్ semblance of respect, okay, with because of our ancient culture. Yes or no? So soft power అంటే ఏంటి, ఈ resistance mechanism లో instead of killing the antibiotic, try to displace the pathogenic organisms in the gut. How can you do that? With probiotics and prebiotics. So instead of diarrhea, dysentery అయిన తర్వాత at least try to have a Saccharomyces, okay, tablet or Bacillus tablet before if అది తగ్గిపోతుందంటే then go for antibiotic. Okay, so soft power is pre and probiotics is one of the examples. Okay, now so I conclude my study by saying that you cannot use only one mechanism to end the war. So you have to use multiple attempts and multiple types of attempts in order to win over this war or stop this war. Okay, so that your ultimate goal is you surviving. Okay, so multi-pronged strategy is important to prevent war on resistance. So by understanding and leveraging the ecological and evolutionary process underlying the antibiotic resistance, pathogenesis and commensalism, we may be able to more sustainably and peacefully coexist with the diversity of the microbes who live in and on us and around us also. So when I talked about ecology, we are talking about ecology around us, where bacteria are there, they are in us, they are on us. That is your flora. Okay, so if you think that only stopping antibiotics in the hospital is going to be effective, so that is targeted interventions and strengthening AMR mitigation. Most of this antimicrobial transmission is happening where? In the environment. So the foundational layers need to be dealt with, and that foundational layers of this antimicrobial resistant transmission, you can stop it even before it enters your hospital system only with the help of One Health approach. Then only more people will be able to have basic antibiotics, okay, because they are not able to affect more costly antibiotics. So this is what is called as the Swiss cheese model. If you want to go for further details into this and One Health approach, most of it is given with recent literature has been updated in the World WAAR Week, World Antimicrobial Awareness Week material in the WHO website. Okay. Now, so recognize the interconnectedness of human, animal, and environmental health. The focused effort should be directed towards patient at high risks of AMR, okay, especially in resource limited settings and marginalized populations and immunocompromised hosts. Strengthening development and dissemination of guidelines and implementation of the best practices, evaluate and report the metrics. Then only you will be able to control or wall off this problem. Okay, thank you. ఆ రోజుల్లో థ్యాంక్స్ టు పెన్సిలిన్ హీ విల్ కమ్ హోమ్ అని అనేవారు. I cannot assure now. I cannot assure now. Even if the soldier comes to my treatment also, I cannot assure that he will be able to reach his home, because he may not be killed by his enemy bullet, but he may be killed by his own antimicrobial resistant organisms present within his own hospital where he is getting treated. So that is the sad state of affairs. So we need not require nuclear bombs to kill us. We superbugs are enough for us. Okay, thank you.
Thank you so much, sir, for enlightening us on the one of the most critical issues of our time. Thank you. Next, I would like to please stay for 2 minutes, sir. We would like to felicitate you for giving your valuable time. I would like to call Dr. Saptarishi Bose, sir, Dr. PVV Subbarao, sir, to felicitate us, sir. So with further delay, we'll go on to next session. It is by Dr. PVV Subbarao, sir, to share his small experience. This is the final session, okay? We'll be concluding with this session with a feedback and post test.
Good afternoon, all. పోస్ట్ ప్రాండియల్ లల్లో ఉన్నారు అందరూ. Actually, why I started this slide? 50 years back, I completed my, not 50 years, 88, I completed my MBBS in Andhra Medical College. After that, I joined in DST IDD project as a research officer for about 2 years. That was attached to All India Institute of Medical Sciences, Andhra Medical College, and JNU. Sorry. When I got DPH, actually, I approached my madam. I don't want to name. Just you crossed 30 years and you won't get any government job. Why you have chosen DPH? After those 2 years, actually, I got, when I was working in DST IDD project, goiter control program, I worked in agency area, Paderu Arku, Munchingput, Jalaput, that area. 196 villages. We have to collect cord blood samples and we have to send those samples to All India Institute of Medical Sciences, Delhi for assessment of neonatal hypothyroidism. 3 years program gone. That is a five years project. I joined in last 2 years. Those 3 years, the past 3 years actually, not even a single card was sent with pure blood. Okay. Along with my 4 assistants, 2 female and 2 male assistants, I used to roam around all the villages and distribute those cards to local dais. And as per the program, actually, 4 rupees supposed to give to those persons. That was not done. And field assistants, they did not get the TA and DA. Only salary they are getting. The medical officer, my senior actually, who worked before, he is getting his TADA whenever he is going to the field and not involving the field assistants. So they are vexed. They are not going to the field and they are not getting the cards. And this is the thing. Why I'm explaining all these things is you can read. Actually, my topic is outbreak investigation. Okay. Public health challenges and outbreak investigation. You can get it, you can read it, and I will present it shortly. First and foremost important thing is actually, after that, I joined DPH and RMC, Rangaraya Medical College, when Ramraj Garu and Chandrasekhar sir is my guru. He used to, appudu, akkada some clashes going on between those 2 professors. And first రోజునే నాకు మిగతా వాళ్ళు చెప్పారు యాక్చువల్గా మిగతా స్టాఫ్ మెంబర్స్ ఇఫ్ యూ మీట్ చంద్రశేఖర్ సార్ యూ వోంట్ గెట్ యువర్ డిగ్రీ అని ఇఫ్ యూ ఎంటర్ హిజ్ రూమ్ బట్ ఇమ్మీడియట్లీ ఆఫ్టర్ 1 hour ఐ ఎంటర్డ్ సార్స్ రూమ్ సార్ నో 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 యూ షుడ్ నాట్ కమ్ go away like. Then I took 10 minutes and again entered సార్స్ రూమ్ అండ్ మీకు ఎవరు చెప్పలేదా చంద్రశేఖర్ సార్ మీరు వినే ఉంటారు యాక్చువల్గా ఆయన ఈజ్ ఎ గ్రేట్ టీచర్ ఈజ్ ఎ ప్రొడక్ట్ ఆఫ్ ఆల్ ఇండియా ఇన్స్టిట్యూట్ ఆఫ్ మెడికల్ సైన్సెస్ అక్టోబర్లో ఆంధ్ర మెడికల్ కాలేజీకి కూడా వచ్చారు యాక్చువల్గా ఏఎంసీకి. సార్ని నేను ఒకటే అడిగా, సార్ నాకు డిగ్రీ వచ్చినా రాకపోయినా బాధలేదు సార్, కొంచెం జ్ఞానం బోధించండి పబ్లిక్ హెల్త్లోను కమ్యూనిటీ మెడిసిన్లోను అని. సార్ ఫెల్ట్ సో హ్యాపీ. ఫ్రమ్ ద నెక్స్ట్ డే ఆన్వర్డ్స్ ఈ టుక్ క్లాసెస్. మా క్లాసెస్ ఎక్కడ జరిగేవంటే గ్యాస్ట్రోఎంటరైటిస్ ఏమైనా గురించి కానీ కలరా గురించి కానీ ఏమైనా చెప్పాలంటే ఎనీ పీడియాట్రిక్ కేసు అండర్ 5 కేసు చెప్పాలంటే వీ యూజ్ టు గో టు ద పీడియాట్రిక్స్ వార్డ్. ఓకే, అట్లాగా ఐడిహెచ్ అట్లాగా ఇంకా కమ్యూనిటీలోకి వెళ్ళి క్లాసెస్ తీసుకోవటం. మనం రాస్తూ ఉంటాం మన పేరు com.med.dgpt ComMed డిపార్ట్మెంట్. ఐఎమ్ సారీ టు సే COM క్లాస్ రూమ్ ఓరియంటెడ్ మెడికేషన్ అయిపోయింది ఇప్పుడు. నో ఫీల్డ్ వర్క్, నో కమ్యూనిటీ వర్క్. హౌ మెనీ ఆఫ్ us ఆర్ హ్యావింగ్ ప్రాక్టీస్? ప్లీజ్ రేజ్ యువర్ హ్యాండ్స్. క్లినికల్ ప్రాక్టీస్ ఎంతమంది చేస్తున్నారు? వీఆర్ సపోజ్ టు డూ. క్లినికల్ ప్రాక్టీస్ని మాత్రం వదలకూడదు యాక్చువల్గా. ఓకే, ఎనీహౌ ఆఫ్టర్ దట్ I had a chance to go to Maldives, and from there I went to Jamaica, West Indies. For 13.5 years as a senior health officer, I worked with Ministry of Health. This presentation was done in 2003. Okay, that time SARS, 2003, SARS, severe acute respiratory syndrome. And I was my responsibility is on par with our state one parish chief, అంటే on par with our state health డైరెక్టర్ ఉంటారు కదా మనకి, ఆ స్టేజ్ అనమాట. మన అండర్ మై కంట్రోల్ యాక్చువల్లీ 24 హెల్త్ సెంటర్స్ అండ్ పోర్ట్ సర్వేలెన్స్, ఎయిర్పోర్ట్ అండ్ సీ పోర్ట్ అంతా ఉంటుంది. అంతా నో కరప్షన్. యూ హ్యావ్ ఫుల్ చార్జ్ ఆఫ్ ద ప్యారిష్. వాట్ ఎవర్ యూ కెన్ డూ. I enjoyed my career, my productive life there in West Indies for 13.5 years. No political influence. I closed Holiday Inn for 33 days for one outbreak. Kitchen, they are not maintaining proper temperatures and those things. And Jamaica is a tourist country. ఒకటి ఆ సార్స్ అప్పుడు ప్రోటోకాల్ అదంతా డెవలప్ చేసినప్పుడు దేర్ economy was raised to 7%. It was officially announced. Okay. Appudu, then I presented this thing to all the stakeholders, airport authorities, seaport authorities, including other people who are inviting the people to Jamaica. Okay. Alma Ata declaration undi kada. ఆల్మా అటా డిక్లరేషన్ ఎప్పుడు ఏ ఇయర్లో గుర్తుందా ఎవరికైనా? ఎందుకు చెప్తున్నానంటే పబ్లిక్ హెల్త్ 1978 ఆల్మా అటా డిక్లరేషన్. ఇఫ్ యూ సీ ద పాయింట్స్ ఇన్ ద ఆల్మా అటా డిక్లరేషన్, ఆఫ్టర్ దట్ కేమ్ హెల్త్ ఫర్ ఆల్ 2000. ఆఫ్టర్ దట్ MDGs, Millennium Development Goals. Now SDGs, Sustainable Development Goals. Now, if you see, most of the things are not fully addressed. Yet we are striving. And that's one thing. This is see the thing here, actually the emerging respiratory diseases, SARS, West Nile disease, dengue fever, and dengue hemorrhagic fever, GE, measles, polio and other vaccine preventable diseases, HIV, AIDS and tuberculosis, malaria. Why I am saying just few slides, I would like to. Oh, okay. Emerging infections. New re-emerging or drug-resistant infectious diseases whose incidence in humans has increased within the past 2 decades or threatens to increase in the near future. It was told in 1992. Still we are discussing about this thing. Okay. Major contributing factors not changed. Human demographics and behavior, technology and industry, economic development and land use, international travel and commerce, microbial adaptation and change, Breakdown of public health measures. Breakdown of public health measures. Some of you might become medical officers of municipal health officers. Now, the powers of MHO, municipal health officer, no powers now nowadays. He can't take any action against any hotel. We used to inspect hospitals, hotels, theaters, slaughterhouses, cemeteries. When you visit, when you inspect the slaughterhouse, pre-mortem and post-mortem examination, actually whether it is properly done or not, actually. Cinema halls, actually, we have to, theaters, if you go there and if you see the toilets are not clean or seats are not properly placed or broken, you can give a closure notice, actually. We are having AP Public Health Law book, actually, that might be a 50 rupees or 100 rupees now. Please read it. As per Public Health Act, we can go into any place, any house at any time if there is any endangering public health issue is there. That laws are there. Laws are there, but we are not implementing. Okay. Just if you were, if you go see the history, actually, Spanish flu, Asian flu pandemic, Hong Kong flu pandemic, hantavirus pulmonary syndrome, they killed millions and millions of people. And H1N1, we are talking about H1N1 now. It was Asian flu pandemic 1957. It happened. Okay. Antigenic drift and antigenic shift. Antigenic drift ante point mutations induced by immunological pressure and new variants emerge constantly, giving rise to yearly epidemics. The same virus, due to mutations, actually, it will repeat. New epidemic will come again. Like COVID, wave 1, wave 2, wave 2, wave 3, like that, actually. Antigenic shift is from non-human to humans. Okay. This during SARS, actually, what we have done, this thing. What is it? We have to know, actually, when we are doing the outbreak investigation, what is a suspected case, what is a probable case, and what is a confirmed case. As for the definition, actually, one or more respiratory symptoms, including cough, shortness of breath, difficulty breathing, and one or more of the following: close contact within 10 days of onset of symptoms, or history of travel within 10 days of onset of symptoms to the area where there is an outbreak of SARS. A probable case, confirmed case when the lab report comes, actually, that is a confirmed case. Droplet, why we are maintaining 3 meters distance, actually. How long the droplet will hang in the air? What are the precautions? When you are sneezing, what is the position we have to take? Okay. Hand washing. Hand washing is more important. And this was the health alert given by the government of Jamaica that time. Any outbreak comes, actually, the health alert will be given by the local authorities or state authorities local authorities ఎప్పుడు ఇస్తాయి అంటే స్టేట్ అథారిటీస్ విల్ డైరెక్ట్ ద లోకల్ అథారిటీస్ టు గివ్ ద హెల్త్ అలర్ట్ టు ద లోకల్ పాపులేషన్. నేషనల్ వైడ్గా నేషనల్ హెల్త్ అలర్ట్ అన్నది సెంట్రల్ గవర్నమెంట్ తీసుకుంటుంది యాక్చువల్గా. Any outbreak, whenever you are investigating, protective garments, surgical scrubs, cap, impervious gown or apron with full sleeves, eye protection, goggles or face shield, respiratory protection, N95. We use it during COVID also. During COVID, actually, I worked in BIMS of 4 months, and the mortality rate is high during the COVID wave 1. Especially, there's a special appointment by the district collector then. Okay, just second. I'm not going into these diseases actually. What are the impending in the examination of point of view, and also if you are leaving the country to any Caribbean island or to any country, outbreak investigation, you should be thorough with the outbreak investigations. During my stay there, actually, I was involved in more than 65 outbreaks. There's a full of hotels, actually, all inclusive hotels. Everything is free. If you pay $200 per day, all liquors throughout the world are there, meat, all foods, continental foods, restaurants, everything is available. So there is any possibility of, and also they can move from one hotel to, there are some packages actually. If you choose a 3 hotel package or 4 hotel package or something like that, you can stay in one hotel for 2 days and shift to other hotel. So if one outbreak is there, foodborne outbreak is started in one hotel, that is a big challenge. If it is a waterborne outbreak, like John Snow, if we know the source of contamination, actually, we can immediately take some action and control measures can be implemented. But foodborne outbreak investigation is a big task, is a difficult one. Actually, you have to get the history of the food items, and that person, if he has taken his food yesterday in this hotel and today morning breakfast somewhere, it is highly difficult to pinpoint which is the culprit, which item is the food item is the culprit actually. That gives you a challenge actually. So you should have rapid response team, actually dedicated team. You should have dedicated team members to investigate. The 10 public health threats to watch in 2025 and onwards as per WHO, mentioned some are covered actually. Antibiotic resistance, climate change and health, mental health crisis, vaccine hesitancy, NCDs, food security and nutrition, health equity, social determinants of health. What are the 4 principles of primary health care? Anyone? Equity. We discussed intersectoral coordination, appropriate technology. Any example for appropriate technology? Good. Pandemics and emerging infectious diseases. This is the biggest challenge. And substance use disorders. This is now plaguing the entire India. If you ask any auto driver or any car driver, they will tell you exactly where the ganja is available. Every nook and corner, every college, not only college actually, the high schools also, high school students are also addicted. Okay, it's a sad thing. This is a challenge to us, a challenge to you, because I am at the verge of retirement. Health technology and data privacy. This is most challenging one. We are maintaining records, health records, electronic records. So hacking is easiest thing now. So confidentiality is at threat. Dance, Dawn, Amitabh Kadu. Disease outbreak news. As per latest WHO disease outbreak news, the public health events or potential events of concern are Marburg virus outbreak in Ethiopia, diphtheria in Africa, Rift Valley fever, Mauritania and Senegal, Nipah virus infection, Bangladesh. Presently, it is going on. July, August news. This is sorry. Ebola virus disease, Democratic Republic of Congo, rabies, Timor Leste, circulating vaccine-derived polio virus type 1, Israel, cholera, multi-country with a focus on countries experiencing current surges. There's so many things are going on. Chikungunya in Leh reunion and Mayoti, and a cluster of community deaths in Basankusu, Equator, Democratic Republic of Congo. That's not they investigated. WHO and others, CDC people are also CDC, Centers for Disease Control, Atlanta. Actually, whenever there is an outbreak, they will send their technical group immediately to investigate. Okay, I visited CDC for 3 times, and from Jamaica, actually, the government nominated my name for short courses to CDC. Unfortunately, I have seen in the corridors of the building, they displayed all the countries they visited, and the country picture is there actually. What is the public health problem of that particular country? India, I am looking for India. I noticed it actually a huge mountain full of garbage. Hmm? Sorry to say this. అండ్ మల్లాది వెంకటకృష్ణమూర్తి తెలుగు నవల్స్ ఎవరైనా చదువుతారా? ఆయన ట్రావెలాగ్ అని రాశారు యాక్చువల్గా ఫ్రాన్స్ వెళ్ళినప్పుడు. ఫ్రాన్స్లో ఒక డస్ట్బిన్కి వాళ్ళు పెట్టిన పేరు జస్ట్ ఇండియన్ టానిక్. Yellow fever is also is a threat to us actually. Presently, there are no cases reported from India, but the vector is here. Aedes is here. Okay, and few years back, some students and some visitors came from Sudan. In the airport, when they screened, some of them are positive for yellow fever. Okay, and yellow fever vaccination. Whenever you are visiting any yellow fever endemic area, you have to take yellow fever vaccination 10 days prior to your departure. Why? Because on the 10th day, the antibodies appear in your blood. Do you know where in your area yellow fever vaccination will be given? Ajagpot, good, excellent. Another? Another center? So Google it or call the district immunization officer actually. Where should I get a yellow fever vaccination? So that even if it is not required for you, actually you have to educate the people who are going to సమ్ అదర్ ఆఫ్రికన్ కంట్రీస్కి వెళ్తున్నారు ఇప్పుడు చాలామంది వెళ్తున్నారు యాక్చువల్గా ట్రావెల్. సో యూ కెన్ అడ్వైజ్ దెమ్ ఎల్లో ఫీవర్ వ్యాక్సినేషన్ తీసుకోవాలి, ఆ సర్టిఫికెట్ క్యారీ చేసుకోవాలి జస్ట్. ఓకే. ఈ గ్లోబల్ ఇన్ఫ్లుయెంజా సర్విలెన్స్ అండ్ రెస్పాన్స్ సిస్టమ్ this is actually the surveillance system, surveillance and preparedness and response for seasonal and pandemic zoonotic influenza, global platform for monitoring influenza epidemiology and disease, global alert for novel influenza viruses and other respiratory pathogens. Their main focus is avian influenza H5N1 virus and present focus avian influenza H7N9 virus. You all know Gavi, Global Alliance for Vaccination and Immunization. Okay. What are the objectives of outbreak investigation? To confirm the outbreak, identify the source and contributing factors, implement control measures are the main objectives of the outbreak investigation. There are 10 steps. You should be thorough with the outbreak investigation, actually. Okay. Detect and confirm the outbreak and agent. If you come to know that there is an outbreak of, there are certain cases of diarrhea in particular community, and or some cases of measles were reported to some pediatrician or pediatric ward to the KGH or wherever you are working, government hospital in Kakinada, Rangaraya Hospital. If the cluster of cases are reported, so you have to send your team member to see and to the hospital, to the pediatrician, confirming that the diagnosis is measles, and also where they are coming from, the area you have to confirm actually. So immediately you alert your response team, rapid response team. And if it is a new case actually, if suppose it is a gastroenteritis due to Campylobacter jejuni or something like that, we don't know what is the pathogen is, and you have to come up with a definition. 3 to 4 vomitings or 3 to 4 loose stools per day, and depending on the symptoms and signs, you have to develop one definition actually. So according to the definition, actually these people, you have to investigate how many of them fall under that particular definition, so that you can differentiate the susceptible case, suspectable case, probable case, and when the result comes, actually when the pathogen is identified, confirmed case. Identify cases and obtain information. Descriptive epidemiological investigation, time, place, and person. Additional studies, environmental and risk assessments, and laboratory. By the laboratory, from the laboratory, we'll get the results. Interview cases and generate hypothesis. We have to generate one hypothesis, and the hypothesis should be tested or evaluated, that actually whatever hypothesis you develop. Inform your risk managers and implement control measures, the 9th one. And final thing, report submission is most important. That should include all findings actually, since the first case actually. When I was there in Rangaraya Medical College, actually, Chandrasekhar sir one day called me and sent me to Peddapuram, nearby village. There was a GE outbreak was there. And collector called a meeting, and collector sent a message to our department SPM department in Rangara RMC, and asked us from our side also submit a report. So sir sent me, you go there and get the report actually. I went there alone, and first I met the municipal authorities. I took the plan, town plan, and water supply area. I visited the water supply area, and there actually one from one terrace actually the cylinder, chlorine cylinder was there actually. They signed, and date was signed actually 4 months back. It is empty. ఓకే దట్స్ ఎవ్రీథింగ్ ఈ స్మార్ట్ ఫోన్స్ అప్పుడు లేవు, నోట్ చేసుకోవటమే జస్ట్ దీంట్లో. ఐ వెంట్ టు ద హాస్పిటల్. ఫస్ట్ కేసు ఎక్కడి నుంచి వచ్చింది ఏమిటి అని చెప్పేసి చూస్తే కనుక ఒక హాస్టల్ నుంచి స్టూడెంట్స్ అండ్ ఒక స్టూడెంట్స్ వచ్చారు యాక్చువల్గా. ఒక 5 స్టూడెంట్స్ కేమ్ ఫ్రమ్ వన్ హాస్టల్. ఐ వెంట్ టు ద హాస్టల్. అక్కడికి వెళ్ళిన తర్వాత యాక్చువల్గా దెన్ ఐ కేమ్ టు నో the cook was the first culprit. He suffered from diarrhea. He did not get the medication. He did not go to the hospital. He met an RMP and get some antibiotic and spread the disease to the students. So first index case actually, when you have to find the index case actually, even from a hotel, suppose if an outbreak occurs in a hotel, ద సేమ్ థింగ్ హ్యాపెండ్ ఇన్ వన్ హోటల్, ఇన్ సన్సెట్ హోటల్ అని చెప్పేసి జమైకాలో మేము ఇన్వెస్టిగేట్ చేస్తున్నప్పుడు ఐ ఆస్క్డ్ యాక్చువల్లీ హూ ఇస్ ద ఫస్ట్ కేస్. అది మాకు ఫస్ట్ కేసు పట్టుకోవటం చాలా కష్టమైంది. 2 days అయినా 3 days అయినా ఇది అవ్వలే. అప్పుడు అసలు స్టాఫ్ని అందరినీ మేము ఇంటర్వ్యూ చేసాం. స్టాఫ్ని అందరినీ ఇంటర్వ్యూ చేస్తే ఒక మెంబర్, ఒక సర్వర్ యాక్చువల్గా, అతను ఏంటంటే విజిటర్స్కి కిచెన్ నుంచి ఫుడ్ తీసుకెళ్తాడు యాక్చువల్గా. కొంతమంది టూరిస్టులు రూమ్లో పెట్టామని చెప్తారు యాక్చువల్గా. ఫుడ్ రూమ్లో పెట్టేసేస్తే మేము బయట స్విమ్మింగ్ పూల్కి వెళ్తున్నాం లేదా షాపింగ్కి వెళ్తున్నాం అని చెప్పేసి. దట్ పర్సన్ యాక్చువల్లీ ఆస్క్డ్ లీవ్ ఫర్ couple of days because he was suffering from severe diarrhea. The manager said no leave. The hotel is full, no leave. So he is still working. This outbreak started in the hotel. 233 cases. At the same time, సైమల్టేనియస్గా మా ఇన్వెస్టిగేషన్ ఇది జరుగుతూనే ఉంది. ఇటు సైడు మా పబ్లిక్ హెల్త్ స్టాఫ్, నర్సెస్ అండ్ ఇన్స్పెక్టర్స్ వీళ్ళంతా దే ఆర్ ఫిల్లింగ్ అప్ ద ఫార్మ్స్, ఇంటర్వ్యూయింగ్ అండ్ దోస్ థింగ్స్. యాక్చువల్లీ దిస్ గై కేమ్ టు అవర్ notice actually. We went to his community. There we found another 24 cases. See, the magnitude of the problem actually, we have to use our brain actually to see how fast we can act, how soon we can reach the people, and how soon we can control the outbreak. Okay. Salmonella D actually is the pathogen, and the microbiologist, we have to thank to the microbiologist actually. Even after identifying the pathogen, our investigation won't stop there actually. How this pathogen came actually. The papaya fruits actually, they use it to wash చేసిన తర్వాత స్టోర్ చేస్తారు. అది వాష్ చేయకుండా ఇచ్చేస్తే పపాయ దేని మీద, స్కిన్ మీద ఆ స్క్రాప్ చేస్తే దాని మీద మాకు ఆ ప్యాథోజన్ వీ కుడ్ ఐడెంటిఫై. బిగ్ హాస్పిటల్స్లో, సారీ హోటల్స్లో ఏం చేస్తారంటే దే విల్ సర్వ్ బ్రేక్ఫాస్ట్ అండ్ ఆమ్లెట్. బ్రేక్ఫాస్ట్ ఆమ్లెట్ అండ్ బ్రెడ్ అండ్ ఆమ్లెట్. దానికి వీళ్ళు ముందు రోజు నైటే ఎగ్స్ బ్రేక్ చేస్తారు. ఆ ఎగ్ యోక్ని స్టోర్ చేస్తారు. బకెట్స్ ఆఫ్ ఎగ్ యోక్ విల్ బి స్టోర్డ్. The next day morning, they make the omelets and serve the food. కొంతమంది హాఫ్ బాయిల్డ్ చాలు అని చెప్పేసి హాఫ్ బాయిల్డ్ చాలా హెల్దీ అని చెప్పేసి తింటారు యాక్చువల్గా. వాళ్ళకి పట్టుకుంటుంది ముందర యాక్చువల్గా. అలా స్ప్రెడ్ అవుతుంది. అది మనం హోటల్స్ పెద్ద పెద్ద హోటల్స్కి చాలా ఫేమస్ హోటల్ అని చెప్పేసి వెళ్తూ ఉంటాం. ఈ కంటైనర్స్లో పెట్టి కింద చిన్న క్యాండిల్ లైట్ దాన్ని పెట్టి ఫ్లేమ్ తోటి ఇచ్చేస్తూ ఉంటారు యాక్చువల్గా. ఎప్పుడు కూడా వెన్ ఎవర్ యూ ఆర్ ఈటింగ్ ఇన్ దట్ ఫ్రమ్ దోస్ కంటైనర్స్ యాక్చువల్లీ యూ స్టర్ ఇట్ అప్. అడుగు నుంచి యాక్చువల్గా మీరు ఒకసారి 2-3 సార్లు కదిపి అతను సర్వ్ చేసుకుంటుంటే ఏదో సర్వ్ చేస్తున్నది మనం ప్లేట్లో పెట్టుకుని ఇప్పుడు బఫేలు వచ్చేసే కదా జస్ట్ అట్లాగే వెళ్ళిపోవడం కాదు. స్టర్ చేసి కిందది వేయమని చెప్పాలి యాక్చువల్గా. కొంచెమైనా హాట్గా ఉంటుంది. మేము ఎన్ని త్రో చేసేసేవాళ్ళము. ఫుడ్ ఇన్స్పెక్షన్స్ జస్ట్ చేసేవాళ్ళం అనమాట. థర్మామీటర్ తోటి ఇచ్చేసుకుంటే కనుక పర్టికులర్ టెంపరేచర్ లేకపోతే యూజ్ టు త్రో ఇట్ అవుట్ యాజ్ పబ్లిక్ హెల్త్ టీమ్. We are having those powers actually. If we are honest and sincere and in our field, nobody will stop us. ఎప్పుడైతే మనం ఒకళ్ళకి తలవగ్గటం మొదలు పెడతామో అక్కడ మనల్ని ఉంచేస్తారు, పూర్తిగా ఉంచేస్తారు. మన చేతిలో పవర్స్ ఏమి ఉండవు, ఒక సాల్యూట్ కొట్టడం తప్పించి. ఐఎమ్ నాట్ గోయింగ్ by point because you have to go back. Once the outbreak is confirmed, investigation needed and form the rapid response team, as I said. And sometimes actually before any outbreaks, we used to have in our departments the rapid response teams, stakeholders and roles: local regional public health agency, overall coordination, food and water authority, environmental investigation, water supplier, healthcare providers, control measures implementation, healthcare providers, case management, lab, microbiological investigation, communication experts. Actually, we should have some public health educators. We have to, without community participation, we can't do anything. Community should accept us and we should be accessible to them and we should be available to them, to the community, and we should educate them. Community education is a must actually. And also at the same time, public health principle is you should not panic the public. ఈ లాక్డౌన్ పెట్టేస్తున్నట్ట, జించేస్తున్నట్ట, ఎంతమంది ఇది అయిపోతుందన్నట్టు. డ్యూరింగ్ యాక్చువల్లీ కోవిడ్, సో మెనీ లాస్ట్ దేర్ లైవ్స్ ఆ ప్యానికీ సిచ్యువేషన్లోనే. ఫ్యామిలీస్ తీసుకొచ్చి వదిలిపెట్టేసి వెళ్ళిపోయేవాళ్ళు. నో యాక్సెసిబిలిటీ, నథింగ్. పక్కన చూస్తే ఇటు సైడ్ బాడీ లేచిపోయేది, మొన్నటికి ఈ మధ్య బాడీ లేచిపోయేది. వీ ఇంప్లిమెంటెడ్ యాక్చువల్లీ అప్పుడు స్మార్ట్ ఫోన్స్ నర్సులకి, డాక్టర్స్కి వీళ్ళకి ఇచ్చి యాక్చువల్గా ఆ పేషెంట్ తోటి ఫ్యామిలీ మెంబర్స్తో మాట్లాడించాం. అట్లాగా యాక్చువల్గా రికవర్ అవ్వటం మొదలుపెట్టారు. యాక్చువల్గా విజిట్ టు డిశ్చార్జ్ ద ఫస్ట్ వేవ్ కోవిడ్. Hypothesis, generate hypothesis. Time when they were infected, place where they were infected, and person, what are the symptoms and etiology, who was infected. అవన్నీ మనం దీన్ని తీసుకుని యాక్చువల్గా ఒక హైపోథిసిస్ని డెవలప్ చేస్తాం. If it is a waterborne outbreak, actually, a description of the water supply system, water source, abstraction points and distribution network, treatment process, storage tanks, distribution network, location of potential contamination sources. There is a famous, if you go to CDC, Now, there are two old guys actually. Now, ఇప్పుడు యాక్చువల్గా మరి ఉన్నారో 100 ఇయర్స్ దాటి ఉంటారో తెలియదు కానీ వాళ్ళు ఒక కేస్ షీట్ ఇస్తారు యాక్చువల్గా. దేర్ నేషనల్ పార్క్, అమెరికాలో ఉండే నేషనల్ పార్క్లో ఒకసారి అవుట్బ్రేక్ వచ్చింది. ఫుడ్ బోర్న్ అవుట్బ్రేక్ వచ్చింది. వస్తే అది పెద్ద బిగ్ ఇష్యూ అయింది. టీం వెళ్ళారు, ఇన్వెస్టిగేటింగ్ టీం వెళ్ళారు. ఆ టీంలో ఒక జమైకన్ ఉన్నాడు యాక్చువల్గా. అతను చూస్తే యాక్చువల్గా టాయిలెట్ నుంచి వస్తున్న పైపు ప్లస్ వాటర్ పైపు సైమల్టేనియస్గా పక్కల నుంచి వెళ్తున్నాయి. ఒకటి బ్రేక్ అయింది జాయింట్ దగ్గర. కంటామినేషన్ అక్కడ స్టార్ట్ అయ్యింది. కంటామినేషన్ అక్కడ స్టార్ట్ అయ్యి వాటర్ పైప్లోంచి దీనికి క్యాంటీన్కి వస్తుంది. క్యాంటీన్లో వాటర్ పీపుల్ తాగుతున్నారు, సిక్ అవుతున్నారు యాక్చువల్గా. ఇతను ఆ వాటర్ బాటిల్లో ఆ వాటర్ను పట్టుకొని వచ్చాడు. దాంట్లో కనిపిస్తోంది యాక్చువల్గా కంటామినేటెడ్ ఎల్లో పార్టికల్స్ ఇవన్నీ కూడా కనిపిస్తున్నాయి. ఇస్తుంటే అక్కడ జమైకాలో లాంగ్వేజ్లో, లోకల్ లాంగ్వేజ్లో యా మ్యాన్ అంటారనమాట. యా మ్యాన్, యు ఆర్ రియల్లీ సప్లయింగ్ షిట్ మ్యాన్ అన్నాడు అతన్ని. యు ఆర్ సప్లయింగ్ షిట్ మ్యాన్ అండ్ ఆర్ ఆల్సో యు ఆర్ డ్రింకింగ్ షిట్ మ్యాన్ అన్నాడు. అతను యాక్చువల్గా ఆ క్యాంటీన్ ఓనర్ ఈ రిపోర్టెడ్ టు ద సెనేట్. కాంగ్రెస్ పిఎంఎన్కి ద్వారా కాంగ్రెస్కి రిపోర్ట్ చేశాడు. ఈ బ్లాక్ పర్సన్ అవమానించాడు, ఇలాగ ఇచ్చేస్తున్నాడు అది ఇది అని చెప్పేసి. వాళ్ళు పెద్ద ఇన్వెస్టిగేషన్ జరిగింది. మీరు గూగుల్ చేస్తే అది ఆ ఇన్సిడెంట్ మీరు వస్తుంది యాక్చువల్గా, మీరు చదవండి యాక్చువల్గా. అంటే పవర్స్ తాలూకా పబ్లిక్ హెల్త్ తాలూకా పవర్స్ చెప్తున్నాను మీకు యాక్చువల్గా. అది కాంగ్రెస్ మెన్ వీళ్ళంతా ఇచ్చేసి అమెరికన్ కాంగ్రెస్ అంటే నోట్ టు ద సిడిసి పర్టికులర్ డాక్టర్ దగ్గర నుంచి అపాలజీ పంపించమని చెప్పేసి ఇచ్చేశారు. ఆ డైరెక్టరు వాట్ హ్యాపెండ్ అనేది క్లియర్గా రాసి యాక్చువల్గా ఇది లేమ్యాన్ వర్డ్స్లో అతనికి అర్థమయ్యే రీతిలో చెప్పాడు. మేము చెప్తున్నది ఏంటంటే దే ఆర్ డ్రింకింగ్ వాటర్ మిక్స్డ్ విత్ స్టూల్స్. దట్ ఈస్ ద మీనింగ్ ఆఫ్ దట్ వర్డ్, దట్ సెంటెన్స్ అని చెప్పేసి వీళ్ళు క్లియర్ కట్గా రాసి మళ్ళీ కాంగ్రెస్కి చెప్పి అతని చేత, నేషనల్ పార్క్ ఓనర్ చేత ఈ డాక్టర్కి అపాలజీ చెప్పించారు దీంట్లో. ఓకే, we have to see all the if it is a waterborne outbreak, actually we have to see endpoint మనం క్లోరినేషన్ చేస్తాం. ఎండ్ క్లోరినేషన్ ఎక్కడ జరుగుతుంది? లాస్ట్ హౌస్ యాక్చువల్గా ఇది అవుతుందో అక్కడ కూడా మీరు క్లోరిన్ లెవెల్స్ ఫస్ట్ పాయింట్ దగ్గర ఎంత ఉందో అక్కడ కూడా అంతే ఆ రీడింగ్ ఉండాలి. సేమ్ రీడింగ్ యూ షుడ్ గెట్ యాక్చువల్లీ. ఓకే, హైపోథిసిస్లోనే ఏజ్, సెక్స్, రెసిడెన్స్, వర్క్ ప్లేస్, రొటీన్, మైక్రోబయాలజీ, ఇంక్యుబేషన్ పీరియడ్ ఇవన్నీ వస్తాయి. యూ కెన్ రీడ్ ఇట్. హైపోథిసిస్ డెవలప్ చేసిన తర్వాత జస్ట్ వీ హ్యావ్ టు డూ ద స్టడీ అనాలిసిస్ ఆఫ్ ద హైపోథిసిస్. డేటా, మనం డేటా కలెక్ట్ చేసుకున్నాం, దాన్ని అనలైజ్ చేయటం ఎయిదర్ త్రూ కోహార్ట్ స్టడీస్ ఆర్ అండ్ కేస్ కంట్రోల్ స్టడీస్ లాగా ఇచ్చేసి we use it to analyze the data. And the people we are inclusion criteria and exclusion criteria. అందరూ కూడా inclusion criteria same water or they are using the same water source, the contaminated water they are using. Okay, exclusion criteria lo those people who are not using that particular water, exclusion criteria. Okay. ఒక ఒక టేబుల్ వేసుకొని ప్యాథోజన్ ఐడెంటిఫైడ్ ఇన్ క్లినికల్ కేసెస్ ఫౌండ్ ఇన్ వాటర్ ఏ, water quality B, water quality failure and or water treatment problem of relevance, but outbreak pathogen is not detected in water. Problem is there, but the pathogen is not detected. B. C. Evidence from an analytical case control or cohort study demonstrates an association between water and illness. D. Descriptive epidemiology suggests that the outbreak is water related and excludes obvious alternative explanations. Strongly associated if A plus C or A plus D or B plus C. Probably associated B plus D or C only or A only. Possibly associated B only or D only. Main important thing is pathogen. If the pathogen is there, actually, the source is contaminated. The related study, some example. I'm skipping it. Report rating. This is more important actually. Communicate findings, make recommendations, and evaluate the outbreak response. Communication should begin early. And every day, actually, you have to note down. Actually, you have to send your higher authorities what is going on, and every day you have to send the report, what is being done, and control measures. What control measures you are taking? If that is a waterborne outbreak, actually, you are educating people not to drink that particular water and boil water. What is the best purification method for water? Rolling boiling. Okay. Control measures should be communicated continuously to relevant stakeholders. And chlorine tablets kuda doruktayi market lo. One chlorine tablet will purify 20 liters of water. Okay. The public health should receive regular updates. Detailed outbreak report should be written and signed and submitted. After action review, outbreak detection and alert. Suitability and speed of implementation of control measures. Outbreak reporting and communication. What are the gaps? What worked well? And who did well? And which team actually? There are several teams you are employing actually to investigate actually. Which team? You have to appreciate your team members. Okay. Thank you all. The surveillance should go on. Notification is the key. And commitment, support at all levels. Be sincere, be honest, and never bow your head actually. We can do anything actually. Below the earth to above the sky. మన శాటిలైట్స్ దాకా కూడా వెళ్ళి మన క్వశ్చన్స్ అట్లా వస్తాయి మీకు. టెక్ ప్రొఫెసర్స్ కొంతమంది ఉంటారు కూర్చొని దీంట్లో ఫీల్డ్ ఎక్స్పీరియన్స్ లేని ఇస్తారు, ఏదో ఒకటి ఇస్తారు యాక్చువల్గా. ఒకటి అన్ఎక్స్పెక్టెడ్ టెక్ క్వశ్చన్ మాత్రం డెఫినెట్గా వస్తుంది. దోజ్ హు ఆర్ ఇన్ ద పబ్లిక్ హెల్త్ దీంట్లో. కమ్యూనిటీ మెడిసిన్ అంటే ఐ హ్యావ్ బ్యాడ్ ఎక్స్పీరియన్స్ యాక్చువల్లీ. దేశం మీద సేవ కొద్దీ వివేకానందుడి బోధనల వల్ల మళ్ళీ బ్యాక్ వచ్చి అమ్మ గురించి వచ్చాను. బ్యాక్ కేమ్. ఐ లాస్ట్ మై మదర్ డ్యూ టు ఓవేరియన్ క్యాన్సర్. ఐ లాస్ట్ మై ఫాదర్ ఆల్సో ఆఫ్టర్ షీ గాన్. వచ్చినప్పుడల్లాగా I studied my intermediate in Srikakulam during 75 and 77. So, serving back to the community. ఇక్కడ ఇంతకు ముందు రాజమండ్రిలో చేశాను. ఐ బాండ్ దేర్. సో రాజమండ్రిలో చేశాను. అట్లాగా చేస్తాను. మై ఫ్యామిలీ ఈజ్ ఇన్ స్టేట్స్. మై సన్ జస్ట్ ఫినిష్డ్ PhD in astrophysics. My daughter is a software engineer. my wife, she's a doctor. వాళ్ళు నేను దేంట్లో పిల్లలిద్దరూ డాక్టర్ కావమని చెప్పారు మా బాధలు చూసి. జస్ట్ థ్యాంక్ యూ ఆల్ ఫర్ లిజనింగ్. నేను ఇఫ్ ఐ కుడ్ నాట్ speak well or explain well, please excuse me. I had my bypass done couple of years back and a little tension is there. So I wish you all the best and అందరూ కూడా మంచి మంచి పొజిషన్స్కి రావాలని మనస్ఫూర్తిగా కోరుకుంటున్నాను. థ్యాంక్ యూ ఆల్.
Thank you so much, sir, for sharing all your experiences. Sir, please stay for 2 minutes. We would like to felicitate Dr. Subbarao, sir. I would like to call Lahari ma'am and Bose sir to felicitate, sir. So in the meanwhile, please fill the post-test form. The link will be shared in your group. So please, this is the first ever CME we have conducted. So please provide us with the feedback. So today we were late, so unable to conduct that group activity. So please provide us with the feedback so that we can improve in the further CMEs. We thank Dr. Lahari ma'am for patiently being here and observer for the day. Thank you, ma'am. So whoever submitted the feedback form mostly will be getting the certificate. So please provide us with the feedback.
Let them submit the posters. Okay, so finally we have come to end of the session. Before I say my regards, I think Dr. Dinkar is there from AMC Postgraduate. He wants to share some news with you.
గుడ్ ఈవినింగ్ ఎవ్రీవన్. కంగారు పడకండి, ఇంకో సెషన్ ఏం తీసుకోవట్లేదు, అయిపోయినట్టే సెషన్స్ అన్నీ. సో ఐఎమ్ హియర్ టు గివ్ యూ ఏ జెంటల్ రిమైండర్ అబౌట్ 30th ఆంధ్రప్రదేశ్ స్టేట్ ఐఏపీఎస్ఎం అండ్ IPHA కాన్ఫరెన్స్ ఆర్గనైజ్డ్ బై డిపార్ట్మెంట్ ఆఫ్ కమ్యూనిటీ మెడిసిన్ in Andhra Medical College under the leadership of Dr. A. Krishnaveni ma'am. So I'm here to just remind you that today is the last date for the registration. People, those who are not yet registered, please kindly do register, and we invite all of you to our conference. Thank you.
So having said that, I hope that conference is in 10 days. So, but I think today you might have gained some knowledge. At least now, at least you know. Hemant, the veterinary surgeon, and I thank all my staff. They have really kept up